Okay, I'd like to call to order this meeting of the First5 Sacramento Commission for Monday, August 4th, 2025. Madam Clerk, will you please call the roll and establish a quorum?
Yes, sir. Chair Serna.
Here.
Commissioner Wesley.
Here.
Commissioner Fernandez Garcia, not here today. Commissioner Gordon.
Here.
Commissioner Casiria, not here today. Commissioner Katari.
Here.
Commissioner Moak.
Here.
Commissioner Kennedy, not here today. Commissioner Hassett.
Here.
Commissioner Williams.
Here.
Commissioner Evans, not here today. Commissioner Guerra.
Here.
Commissioner Boston.
Here.
And Commissioner Kravitz-Wertz.
Here.
Thank you. We have quorum.
Very good. If you could please read our statement.
This meeting of the First5 Sacramento Commission is live and recorded with closed captioning. It is cablecast on Metro Cable Channel 14, the Local Government Affairs Channel on the Comcast and DirecTV Uverse cable systems. It is also live streamed at metro14live.saccounty.gov. Today's meeting replays Friday, August 8 at 2 p.m. on Metro Cable Channel 14. Once posted, the recording of this meeting can be viewed on demand at youtube.com/metrocable14.
Great, thank you. If you'd please rise and join newly minted Commissioner Eric Guerra in the Pledge of Allegiance.
Salute, pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Again, I'd like to welcome everyone to this afternoon's monthly First5 Sacramento Commission meeting. I see some folks entering the back of chambers now, and it looks like they're getting ready to sign up to speak. And again, as a friendly reminder, we certainly encourage you to address the commission on any item that is on our published agenda or any item that is not on our agenda. We ask that you please respectfully keep your comments to no more than 3 minutes. That way, anyone that wishes to address the commission has the opportunity to do so. We have a full agenda today, and I think before we get started, as I just alluded to, I want to welcome Sacramento City Council member representing the 6th District, Mr. Eric Guerra, who is our newest member of the commission. It's good to see you up here, Eric. He's also my compa, so, and he has 2 wonderful young sons that I'm sure he would love to proudly elaborate on. But he comes to this commission, I think, with a very respectable track record, especially in the space of early childhood education and development. And he comes from that place of being a very practicing parent. So, council member, I don't know if you'd like to make any introductory comments, but the floor is yours.
Well, thank you very much, Chair. And it's actually just great to see so many wonderful faces here of people we've worked with together hand in hand for so many years. And yes, I'm very excited and very gracious to be here. And as you mentioned, not only have had the opportunity to work in the First5 sector on early childhood education, but more as a parent right now with one that is just came out of the First5 era and the one that's still in it. We know very well how much that those formative years can shape and make the future for so many. And unfortunately, so many parents and so many young kids don't have all the resources they need at that time. So the work that we do here is critical. And so thank you, Mr. Chair, for that opportunity.
Yeah, very good. And welcome. I believe we have another new member to the commission, looking to my right now. Shelby Boston brings over 25 years of social services experience to the commission. She assumed the director of DCFAS in January of 2025, and then prior to that, she served as the director over the Department of Employment and Social Services in Butte County for the past 8 years. She also served as the chair of the First5 Commission in Butte County for 3 years and vice chair for 5 years. She has a passion for child abuse prevention work and is excited to bring Her experience and knowledge to this commission, Shelby is most proud of her family and their commitment to being public servants. Her husband served 34 years in the fire service, retiring in November from CAL FIRE. We certainly appreciate his service in that regard. It's very important, especially as we're reminded this time of year. Shelby is also a mom to 2 boys, Zach, age 24, and Colby, age 19. Her eldest is an officer in the U.S. Army, and her youngest son is currently in ROTC at Sac State. Go Hornets, Stingers up. And will be serving as an officer in the U.S. Army upon his graduation from Sac State. So, Shelby, welcome, and the floor is yours if you'd like to make any introductory comments.
Thank you. I'm really excited to be a part of the commission and bring all my experience and be a support to the good work that's done here in Sacramento. So thank you.
Great. I've had the opportunity to work with Shelby now for a few months, and it has been seamless in terms of not skipping a beat when it comes to important social service policy implementation and resource allocation responsibilities that the Board of Supervisors has, working closely with our executive team, and Shelby has proven already to be just a wonderful addition in that regard. So, welcome. All right. With that, I think we will get on to our agenda. Madam Clerk, our first item.
Item number 1, approval of June 2nd, 2025 draft action summary.
Okay. First of all, I will ask the clerk, do we have anyone signed up to speak on this matter?
No, sir, we do not.
Okay, very good. Does any member of the commission wish to make comment or pull this item for separate vote? Hearing none, I would entertain a motion.
So moved.
It's been moved. Is there a second?
Second.
It's been moved and seconded. Roll call vote, please.
Chair Serna,
Aye.
Commissioner Wesley,
Aye.
Commissioner Williams,
Aye.
Commissioner Gordon,
Aye.
Commissioner Guerra,
Aye.
Commissioner Gattari,
Aye.
and Commissioner Moak.
Aye.
Thank you. Motion passes.
Very good. Thank you. All right, we're on to separate matters. This next item is the public's opportunity to address the commission on any item that is not on our agenda. We certainly, again, welcome your testimony. Those that would wish to address us off agenda, please realize that state law forbids us to go into great detail on your subjects, as it would violate the Brown Act, but we certainly want to hear from you. So, Madam Clerk, do we have anyone sign up on off agenda?
No, sir.
All right, very good. Then we are on to the next item, which is the Executive Director's report.
Good afternoon, Commissioners.
Good afternoon.
Pleasure to see you all. I have a couple of things to highlight from my Director's report. I'll start with our Equity in Action Committee update. This is kind of the most fun I've had at work in a while, actually, and the most learning that I've been doing at work in a while. Our Equity in Action Committee, as a reminder, that is how we're putting out over $4 million to the community in participatory grant-making process. So for the first time ever, allowing the community to tell us, to inform us on the process and the awards to be made. So very exciting stuff. We have 2 members of our 15-member committee joined us in the audience. So I'll ask Carol Belisi and Alberto Mercado to stand, please. Thank you. They are energetic. They bring all kinds of amazing information and are thought partners in how to do this work. So just wanted to acknowledge them. Others might be popping into future commission meetings as their schedule permits, just to see how we operate here. And they each represent one of our priority zip codes. As a reminder, we have 11 communities that we will be focusing these funds on toward advancing racial equity and building stronger families. So I'll move on and talk a little bit about our Parent Partnership Summit. We had parent leaders, more than 70 parent leaders gathered in June in Natomas to celebrate a year worth of work and and start to plan for what they want to do next. We had, it was opened by Chair Cerna, and then we had a couple of commissioners sit on a panel, Commissioner Wesley and Commissioner Guerra. Both were panel members. It was a pretty
We're
spectacular.
going to have to learn how to roll our R's now, right?
Guerra. Okay.
Guerra.
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 I will work on
Yes,
that.
all right.
I will do my best. So yes, it was a great day. It was, I think, like 6 hours. We had kids were there. There was a magician that showed up to entertain the children while the parents were doing the good work in the other room. It was really, really fantastic. Other updates that I'll highlight is something that you'll all be getting an invitation to very soon, which is our Potter the Otter Museum exhibit. So Potter the Otter was created by First5 Santa Clara about a decade ago. It's a series of books, and then they partnered with the San Jose Children's Museum to create a traveling exhibit where Potter will come out to different counties at their children's museums. We have a First5 partnership with them. We're going to be hosting free days for kids 0 to 5. We're going to be putting our community resources like Help Me Grow and the Family Resource Center from Rancho Cordova area will be out there on site. We have a kickoff happening on August 19th. And so that's what you will be invited to. We have both Chair Cerna and Commissioner Guerra, thank you, we'll be doing some opening remarks as we do a ribbon cutting that day. If kids will be there playing, you'll get to walk through the exhibit. We'll have snacks, breakfasty snacks, so please do come. It'll be at 9 o'clock in the morning, but we will send out a calendar invite for you. Other news, just something to, it's a bit of a tease, I know. Sacramento International Airport Child Care Center. So this is something that First5 is exploring with our airports department here at the county. We're currently working on an MOU, which we will bring to you at the next meeting, to be thought partners, to set the table and convene other child care partners from the area, and to put together a child care feasibility study to see what it would take to get child care center at the airport for not only airport employees, but like the contractors who do some of the more, the other services at the airport as well. It's very exciting. We have already started pitching it to our legislators. We'll need a $1 to $2 million initial investment for a build out of a space that's already sitting there ready to go. And then they'll use a sliding scale and a mixed portfolio for who pays what for spaces. So they have an idea already in mind, and they'll also be, part of the plan is to charge a tiny fee to the contractors of the airport so that they would be able to sustain it long term. So we've put in some thought, and this contract will help us dedicate some more staff time to really get down to it and hopefully be bringing it. If we pull it off, we will be, I think, the fourth airport, the third or the fourth airport in our country that has a child care center located on site. So definitely more to come starting next commission meeting.
I'm sorry, Julie, did you mention whether or not there's any ceremonial ribbon cutting or anything for this? I'm a politician. We got to have
Yes, I know.
ribbon. Okay.
You have to give us at least a year to get this thing done.
All
Okay, sorry. But I really am fingers crossed on this. We have real wonderful leadership in our county airports.
We do. And
Yes.
yeah, I can't say enough good things about our airport system and the leadership and
Yes.
the executive roles there. And this is a very welcome addition.
This would be amazing. So I will keep you posted. I have some information about the state budget and the federal budget, including a handout from the First5 Association. I won't take a lot of your time, but what I'll say is with our state budget approved in June, and then the federal budget bill passed, we anticipate various things to be kicking in over the next 2 years that would really impact services for children and families as they start to take effect. So we're not 100% sure on what that's going to look like, but I just wanted to let you all know, like, what we're doing right now around that is talking to our partners about what local impacts would look like. We're collaborating with our consultant health management associates to look at broader Sacramento and California impacts of policies coming down from the federal administration. We're exploring legislative opportunities with our First5 Association, and we're participating in First5 Association's California Federal Advocacy Work Group. And this is a fairly large work group of advocates from across the state who are meeting now monthly to develop a plan, a strategic plan, if you will, for how to address these potential impacts and to sort of speak with a unified voice around early childhood to our state and federal representatives. So I will also keep you posted on that. And that concludes my report.
Great, thank you, Julie. Any questions for our executive director? Okay, seeing none. Madam Clerk, do we have anyone sign up to speak on the executive director's report?
No, sir.
All right, very good. Thanks again, Julie.
Yeah.
And we are now on to item 4, which is our advisory committee update.
Great. So I believe we have our chair of the advisory committee to give a update, and then we do have 4 appointments to be made.
Very good, thank you.
Good afternoon, Chair Cerner and Commissioners. My name is Junior Goris, and I'm the chair of the First5 Advisory Committee. The advisory committee met on June 13th, and committee members received a presentation on the First5 budget and 10-year financial plan. We reviewed the 25-26 budget highlights, revenues, and expenditures. Members also received updates from other committees, such as SOS, Financial and Evaluation. And after the meeting, the 2027 Strategic Planning Ad Hoc Committee met and reviewed the recommendations from the parent focus groups. The ad hoc committees included members of the advisory committee and parents from our parent mentoring and advocacy groups run by Lead for Tomorrow. Our next meeting is scheduled for August 22nd, and that concludes the advisory committee report.
Great, thank you, Junior.
Thank you.
Appreciate it. Any questions for Junior? Don't see any. Okay.
No, okay, thank you.
Yeah, you're good. All right, so then we have the appointments you mentioned, Julie.
Yeah, really excited. Some folks are moving to different seats, but we have 2 new seats being filled that had been open. Mael, who was a previous First5 employee back in the day, is now a grandparent and returning in that seat. We have a new member interested in joining Bukola Badamaso is looking for the Parks and Rec seat. Heidi Kaiser is moving to the parent seat, and Keisha Harris to Mental Health Advisory Board seat.
Very good. Okay, so just to be certain, Madam Clerk, we don't have anyone sign up to speak on the appointments, do we?
No, sir.
Okay. Then at this point, I would entertain a motion on the appointments.
I'll make a motion to approve all appointments.
Okay, it's been moved. Is there a second?
Second.
It's been moved and seconded. Roll call vote, please.
Chair Cerna.
Aye.
Commissioner Wesley.
Aye.
Commissioner Williams.
Aye.
Commissioner Gordon.
Aye.
Commissioner Guerra.
Aye.
Commissioner Guattari.
Aye.
And Commissioner Moak.
Aye.
Thank you. Motion passes.
Very good, thank you. And thank you to all of our appointments, wherever you might be, for your continued service and interest in the mission of First5. So with that, we will then now move on to item 5, which is our evaluation committee update. Who's doing that?
That was going to be Dr. K, but she's out, so I think Carmen is jumping in to
All
cover
right.
that one.
Very good.
Good afternoon, Commissioners. I'm Carmen Garcia Gomez, and I oversee the Evaluation Committee. The Evaluation Committee met on July 21st. At that meeting, staff shared a plan to revamp the Commission's annual report, which you will receive in the winter, about January, February timeframe. The updated format will be accessible to a broader audience. Currently, the annual report's about 80 so pages long, and so we are going to shorten that report, and it's going to be about probably 15 to 20 pages max. It will include a data book in addition to it, so for those of you that want to look at the RBAs more closely and other charts and tables and data, that will be a part of it, but it won't be along with the annual report. So we'll be able to share the annual report on other social media formats and whatnot so that a broader audience can look at that. The committee also received an updated trend report, which the commission will receive in October. Staff presented a proposal for a special study on the Parenting Leadership Training Institute program, PLTI. The committee provided input and approved the proposal. The commission will receive a summary next spring. The next meeting of the evaluation committee will be on September 15th, 2025. That concludes my report.
Very good. Thank you. Any questions for Carmen? Okay, don't see any. There's no vote on this. Madam Clerk, do we have anyone signed up to speak on evaluation?
No, sir.
All right, very good. Then we will move on to our Financial Planning Committee update.
All right. The Financial Planning Committee met on July 24th and established a quorum. Staff presented a comprehensive update on the fiscal year 2025-26 revised recommended budget. While there were no changes to program allocations, updated information was shared regarding our fund balance calculations and their impact on the 10-year financial plan. A motion was made to accept the updated changes, and the committee approved the fiscal year 25-26 revised recommended budget and 10-year financial plan, and this is item 8 on today's agenda. The committee reviewed the Commission's financial statements for fiscal year ending June 30, 2025, and the committee was satisfied with the financials as presented and identified no issues of concern. This concludes my report.
Thank you, Vice Chair Hassett. I appreciate that. Any questions from commissioners? Madam Clerk, do anyone sign up to speak?
We do not.
All right, very good. Thanks again. We're on to item 7, which is our Systems Optimization Sustainability Committee update.
All right. Okay. We met June 18th, and we had 2 updates. The first update was related to the state, federal, and advocacy activities. And at that time, we did not have a budget that was approved. We also received an update from the Equity and Action Committee, and we were excited to hear about how that committee was starting to meet and get grounded in the work around the ready participatory grant-making process. And then lastly, we got to receive some insights around the 2024 strategic plan, specifically around the systems improvement priorities and investments. And we are meeting this month on August 20th, and that concludes our report.
Very good. Thank you. Any questions from board members or commission members? Seeing none, Madam Clerk, do we have anyone sign up to speak?
No, sir.
All right, very good. We're on to item 8. This is the approval of the fiscal year 2025-26 revised recommended budget and 10-year financial plan.
Good afternoon. I'm Kristen Scheiber, Chief of Administration for the First5 Sacramento Commission. Today I'll be walking you through the updates to the recommended budget for fiscal year 25-26, as well as our 10-year financial plan. To start, I want to note that there are no line item changes or budget adjustments to report. And if you take a look at attachment 1, which was up on the screen, it's also in your packet. Attachment 1 is the budget highlights document. You'll see that the expenditure and revenue figures remain the same as what was presented to the Commission back on April 7th. What has changed are the carry forward fund balance and the reserve release amounts. For fiscal year 24-25, revenues came in 4.8% below projections, largely due to lower than expected Proposition 10 disbursements. The good news is this shortfall was offset by expenditure savings and higher than anticipated interest income. As a result, the estimated carry-forward fund balance is now $2,683,284, and that's an increase of approximately $737,000 over what was originally budgeted for fiscal year 25-26. The higher carry-forward fund balance allows us to reduce the amount we need to draw down from our reserves. The updated reserve release is now $2,284,019. This is the additional amount required to meet our budgeted expenditures above projected revenue. In other words, what we need to balance the budget. So next is the 10-year financial plan, attachment 2 in your packet. Prop 10 revenue projections have been updated to reflect the state's April forecast, which aligns with what was reported last year in September. Thanks to the higher than expected carry forward fund balance and reduced reserve release, we've been able to lower the projected reduction in the 2027 strategic plan from 22.4% to an even 20%, so a 2.4% improvement. We're hopeful this trend will continue as we realize more carry forward fund balance in the next budget years. This concludes my report on the fiscal year 25-26 revised recommended budget and the 10-year financial plan. I'd be happy to take any questions.
All right, very good. Any questions for staff? All right, don't see any. Madam Clerk, do we have anyone sign up to speak on this item?
No, sir.
Okay, we do need to consider for approval the fiscal year 25-26 revised recommended budget and 10-year financial plan. So is there a motion?
I move.
Okay, it's been moved and seconded. Roll call vote, please.
Chair Cerna.
Aye.
Commissioner Wesley.
Aye.
Commissioner Williams.
Aye.
Commissioner Gordon.
Aye.
Commissioner Guerra.
Aye.
Commissioner Katari.
Aye.
And Commissioner Moak.
Aye.
Thank you. Motion passes.
Very good. Thank you very much. All right, we are on to item 9. This is a presentation on the 2024 to 2027 implementation plan and strategy prioritization and funding allocation timeline for commissioners.
That is a mouthful.
It is.
Happy today to talk to you, take you through the next step of our strategic planning process, which really is our implementation planning process. Because as a reminder, we did extend the strategic plan to 10 years. So now we're just talking about implementation planning. And even though it feels like we just started the current one, we're actually just began our second year of our strategic plan. So we're ready to talk about next one already. The presentation that we'll take you through today is going to outline some of the decisions that you'll be making and the process that staff have been thinking through in order to bring you the information that you need to make those decisions. And at the end of the presentation today, we have some questions to ask you and hope to engage in a brief discussion before we move on to our last item. So I will let Lindsay take this one.
Oh, there it is. Just to orient you, because this is a confusing slide, it's got a lot of layers there. So let me draw your attention to the bottom layer where it says agenda. And these are the agenda items that will come before the commission. And we have one little error there, and that first arrow should be going toward the meeting today where it says we are here. It got away from us. So today we're sharing funding allocation decision criteria. And then at your October meeting, we'll be sharing the community trend report, which talks about how families and children in Sacramento County are doing in general. And we'll report out on our phase 1 community research. So what we're hearing from community about what they, where their strengths and needs are. At your meeting in December, we'll report out on phase 2 of the community research, which is when we take strategies back to the community based on what we heard from them and how they rank those strategies. And we'll offer staff's recommendations on strategy prioritization, so how to prioritize the strategies that have come forward. And then finally, at the February meeting, we'll offer staff recommendations on funding allocations. And then above that, in the dark blue line, you see when the ad hoc community advisory board is meeting, that's helping guide the process for us, like a filter and accountability partners between us and community. And your commission meetings are the line above that, and then the work that's being done, the timeline for that. So as you can see right now, we're in the midst of staff strategy development. And just as a level set reminder, you just heard it, and now you can see it this way too, that we're facing a 20% reduction in funds in the next implementation plan.
Okay. And no surprise, we've never had enough funding to fund everything that we've wanted to over the years. We've always made trade-offs, as you know, and now as our need increases and our funding is decreasing, we have even more sort of trade-offs and things to think about. So we aren't asking you these questions right now. We just want you to sort of have them in the back of your mind, because this is how we're going to end our 10-slide presentation, circling back to these questions after we kind of fill you in on what we're thinking of doing and getting your feedback on it. At the end, we want to make sure that you feel like you have all the information that you need to make these decisions with that 20% reduction coming. Okay, so as part of our last strategic plan, the 10-year plan, the Commission approved these foundational principles, which really, just to highlight again, we're going narrow and deep. We want to leverage as much funding as possible to sustain. We are all about prevention, early intervention, community collaboration. We make data-informed decisions, looking at our community's strengths and the priority areas where we need to focus most to reduce disparities. So those are, in a nutshell, our foundational principles. And as staff really were brainstorming and looking at how to make decisions for making reductions on strategies, we thought we would use these foundational principles, figure out how to operationalize these to make these help us create those recommendations that will come to you later. So,
And Julie, if I
yes.
could just interject here for a sec. And this is just kind of a reminder for the public, but also for the council member. I suspect that Commissioner Boston probably is well aware, since she has got a lot of history with Butte County First Five, but it is principally because of the nature, the uniqueness of our budget, that we have a structural decline in revenue, and it's for a good reason. It's because fewer people are smoking. We always like to say, of course, go ahead and buy the cigarettes, just don't smoke them, right? So therefore, in fact, during my tenure on this commission, we've talked about cliffs, we've talked about soft cliffs, we've talked about, how to avoid that when it comes to strategic planning and implementation of our strategic plans. But it's important, as just a reminder for everyone, that unlike cities and counties that some of us serve on, they're elected decision-making boards or bodies, that we don't have the luxury of assuming that sales tax might pick up at some future year, or property tax might be as sustainable as it might seem, because we just have a very, very different revenue stream here that, again, forces us, quite frankly, to be creative right? And that's why you see operative verbs like leverage in here, and narrow and deep. And so that's, I think, important to stress as we begin to talk in detail about implementation.
Great context. Thanks, Chair Cerna. And as staff looked at these 5 foundational principles, we found that perhaps one was missing, something that we didn't take into consideration, just given the environment that we're working in. And so one thing that we're suggesting is the potential addition of a foundational principle that prioritizes funds that support First5 Sacramento to carry out the mission and the vision that you all have created. And several things I just mentioned, we just started our 2nd year of our strategic plan, and several things have already come to the surface that we are doing business very differently than we were before. And so we are sort of grappling with how we evolve as a commission to be able to do those things. So we've talked about our revenue, which is continuing to decline. And as you all know, we made that pivot in the last strategic plan to also focus more funding on systems improvement. So we were, before that time, primarily a grant-making entity, writing checks, giving money for direct services. In this last strategic plan, we said, let's hold back a tiny bit, like 5% of the money, whatever, it's a very small amount, but let's hold this so that we can start doing some systems work to change things up here as our money decreases. Because again, we will never have enough money to do all the work we want to do. So systems work takes it's a different level of work. It's a different kind of work than being contract monitor and an RFP generator. Then we started building parent power. That has literally moved us out of our offices. We are out in community all the time now, at community events, at parent leadership forums. Our travel budget is kind of funny because during the COVID years, we never went anywhere. Now we have mileage claims again. What? Mileage claims, right? We're just so much more out in community now. And then creating this decision-making process with the community, like equity in action, it's just been a total game changer, where we're learning new things every day. We're challenging assumptions, and again, just changing the way we do business. So all of those things require infrastructure in a different way than it did before. So we're not saying we need to grow. We're just saying that we should look at if these are the things that we value and these are the strategies that will be coming our way in the new implementation plan period. I think it's just going to be really critical to say we have to support the infrastructure that allows us to do it in a successful and in a meaningful way. Yeah. So that is that, and then Lindsay's going to jump back in.
So we just wanted to walk you through the process that staff is thinking of using. So taking these foundational principles and using them as the prioritization criteria. So this, along with trend data and that community input that we talked about, we'll use all of that to bring a list of priorities to the commission to vote on in December. And prior to that, we'll share in the October meeting the community input and the trend data. So you'll have that context as well. So the community may come back to us with a list of 100 different strategies that they'd like to see implemented, right? This is a possibility. And staff are going to need a method to use to prioritize those strategies and to make a recommendation to the commission for your consideration in December. So the method that we're proposing is to operationalize our foundational principles, to use these things as the lens through which we'll analyze the strategies. So, for example, you can see we've listed the principles on the left-hand side and the considerations, how we could use those to prioritize on the right-hand side. So, for instance, make narrow and deep investments to achieve the greatest impact. We could look at the strategies that would result in systems level impact and strategies that address root causes of the challenges that families face, right? It would be one of the lenses through which we would put things. And not that those would be the only things that we would fund, but we'd be creating a balance with these foundational principles in mind. And then that goes on to the other three foundational principles. So looking at community strengths and needs, looking at strategies that build community assets, again, looking at root causes and racial disparities in health and well-being. Just all of these considerations will come into play. And then our data sources would be how things are working right now. The funding landscape assessment, what else is out there? Who can we partner with? Where could we hand something off, or where could we braid a funding stream? Root cause analysis, it goes back to that interest in primary prevention, right? Are we funding things that are addressing what the real causal elements are? Primary research, that's the community engagement focus groups and the surveys. And just to backtrack on that, we held 6 focus groups in the first round with 53 people. We had 2 groups that were just generally caregivers of 0 to 5-year-olds. We had 1 group that was just fathers. It's a group we don't hear from a whole lot. We had 1 group that was an Afghan community group. 1 group of mothers who were experiencing homelessness, and 1 group that was held in Spanish. So just to try to capture sort of the broad community and some pieces of it that we don't often hear from, to make sure that those voices were.
Can I interrupt here?
Yeah.
So those specific groups that you just mentioned, the fathers, the Afghan families, were those kind of self-selected? They presented themselves as kind of representative of those unique population sets because of just their general interest in this, or did we go out and say, well, we'd like to have Spanish speaking, we'd like to have Afghan folks?
It was the latter. It was in combination with that ad hoc community advisory board, helped us figure out which groups we would like to prioritize to hear from.
Okay.
And then in terms of recruitment, it depended on how the group came about. So one of our advisory committee members was already working with a group of women who were experiencing homelessness, so she used them as a focus group. So one of our advisory committee members is a member of the Afghan community, and he recruited families who would like to participate.
In terms of how we get from here to December,
Yes.
are there going to be other opportunities for other represented populations to provide their input?
Yeah, great question. So we're going to do another set of focus groups, as well as a survey, which will be much more broad.
So I'd like to suggest, and others might want to chime in here, but I would like to suggest that one of the emerging groups that I think we need to be cognizant of in terms of our strategic plan and how it is implemented and how we make sure we don't miss specific populations is those immigrant populations that are unfortunately being targeted by the federal administration, and especially as it relates to family reunification. And I know we always have to keep in mind, put on the blinders of 0 to 5, and so I'm not asking you to ignore that, but I think there's enough overlap between that general mission based on the population set that we're charged to focus on, and the fact that we're seeing so much unfortunate, again, targeting is the only word that comes to mind, of that particular part of our community. One way to, I think, to make it easy on staff to to find out who and how best to do that, it would be to reach out to the fuel network. That's kind of that could be considered kind of a one-stop place to find out and explore where that intersection between First 5's mission and their mission, and all the groups that are kind of underneath that umbrella are that we might think about specifically identifying, in addition to all the other groups that have already started participating. But it's timely, and I think it's necessary.
Thank you.
Yeah. Councilmember?
Thank you, Chair. I just wanted to concur in that support, and then also not to forget that when we did the most recent study on the workforce, those who are caretakers and in the workforce for 0 to 5 are predominantly also that sector that's being targeted as well. So when we're talking about not only the families, but the entire workforce, it's one of those that we need to support. So I concur with that, and glad to help coordinate with the fuel network. We do have standing meetings now that we're meeting on this issue.
Okay. Thank you. Commissioner Moak?
Yeah, and I guess to that point, what's interesting and fortunate, I guess, is that for a couple of decades, we've been making investments into built environments, locations, family resource centers that their doors have always been open to these populations, targeted populations and otherwise. And so to me, the opportunity to open the doors wider, to figure out, crack the code on how those places can be made even more safe than they are today and have been. I guess I don't want to throw whatever the baby in the bathwater saying is. I don't want to give up what we've spent 20 years investing in when that is some of the infrastructure that we need in order to harbor and help these people that are being targeted.
Commissioner Wesley?
Yeah, I was just going to say a combination of what you're already thinking is where we strengthen existing partnerships along with maybe possible new ones, which I think that's what you're getting at. And I would just say at my agency where we serve about 160 families and childcare providers, what we've already started to see in Los Angeles is that home visiting, for example, is needing to be done in some targeted zip codes based on what you just shared, Commissioner Cerna, or Chair Cerna, is that some families are going in silence right now. They're hiding in the shadows. And so we're doing home visiting virtual.
Yep.
So there might be pivots, and then domestic violence is something we're seeing for some of our direct services like Head Start. We're interested to see, our kids are coming back in mid-August to see if our attendance goes down or not, but we're already seeing in LAUSD attendance is down. So I think there's a strengthening and a pivoting and new partnerships. So it might just be a combination of what you're already thinking that you're sharing with us right now, as well as doubling down in some areas and shifting. And maybe what's so great about this is because it's a 10-year plan, you guys were so smart to be strategic so that we can make these kind of maneuvers.
Yes.
So
Thank you.
That's all I wanted to share.
That's a great feedback because it isn't written how we're going to do it right now. And so who we talk to in community is really important. And so appreciate all of this guidance for sure. And First 5, as you know, is to serve all children, like capital ALL, all children in Sacramento. So.
And I just want to lift up that there's a difference between strategies and partners, right? So a partner can deliver multiple strategies, and we can have a same partner and tweak some of the strategies as well.
Commissioner Gordon?
Yes, I also wouldn't exclude trying to work with our health systems, our four managed care plans here in Sacramento County. We now have an obligation to collaborate with them through MOUs, but they also, under CalAIM, the governor's strategy, have an obligation to do a lot more on the prevention end with community agencies. So I think that would be worth a set of conversations as well.
Thank you. Okay, good. All right. So back to my questions. How does it all sound? Thank you for the feedback. We've been taking notes, and we absolutely will incorporate more of that community voice, and you will get to hear all of that data as well. But so putting yourselves in your future shoes. So as we mentioned, February is when we'll come with a list of strategies that we're recommending, December, a list of strategies that we're recommending. February is that where the rubber hits the road, and it's more about the allocation of dollars to strategies. And so we're asking you to think, like, what does success look like for making those decisions, knowing we have a 20% reduction, and the support that you might need throughout the process. We have the October meeting, December meeting, and then I think right now just in February. I don't think we have a January meeting, but if we needed a January meeting, we could certainly schedule that in for next year.
Commissioner Qatari.
Yes, thank you. I just am appreciative of staff. This is a great process you're going through, and I think the framework will really help us to make some good decisions going forward. I just want to echo what everyone's saying up here, which is there's not been a time in my career when partnership hasn't been more important. And Julie and the staff have been incredible at partnering with our Health and Human Service departments, and the rest of our partners will continue to do that. We have to come together at this time, and so thank you for the work that you're doing on this. And I see that this process is going to support us in decision making. So apologies, I have to leave early. Thanks.
Thank you.
Okay, so that concludes that. If you have thoughts along the way, please reach out. You definitely all know how to find me. And so we'll continue to work and bring you more information in October.
Great, thank you.
Yes.
Commissioner Wesley.
I actually just had one question. Does anybody know if there's a sort of like a rubric or some type of I don't want to call it a decision-making tool that looks like whole child, whole family, like if I enter into this door, like FRCs, that by entering this door, I get most of my needs met. I know we're thinking about like a universal intake form. Like if I go to FRC that provides concrete services, this particular organization also can provide most of the concrete services, but they might have to refer me out to housing. I'm just thinking about my days as a single mom and needing some of these services, and was on the TANF program, but I was able to go to one place and get a lot of my needs met, or where they couldn't fill in the gap, they were able to.
Yeah. So we created SAC Family Connect exactly for that, so that families wouldn't have to go from here to here to here, basically like a no wrong door. And so it's a whole decision tree that we've trained our not only our funded partners. You don't have to be a funded partner, but if you're a child and family serving agency, we've trained agencies. We have video trainings on our SAC Family Connect website, and it is to be able to say these are the things that this agency can do, and then the agency knows where they're to refer a family to for the next thing, because not one agency, as you say, can meet all the needs of every single family. And so there's a way to query the information for, are you a first-time parent? It will direct you this way. If it's your first baby, it might send you here. If you're Black African American, it's going to send you here first. If your child is older than 6, it's going to send you over there. But then once you get to that place, they will then assess you. So we have MOUs with 36 different agencies that have all agreed to use the decision tree that's inside SAC Family Connect.
I wonder if we use that when we come back to do that looking at the strategies in December, if we use it as a guide or support to us. I'm trying to look to answer your question.
Like what more do you need to help make these decisions?
Yeah, when we come back, like, can we use something like a rubric or borrow something from that, or, gosh, I'm dating myself, like Cliff Notes.
Yes.
Cliff Notes.
We can certainly.
There's a
think
whole
about that.
generation that has no idea what that is.
No. The guy's name was Cliff?
Yeah, right.
Is that right?
That's right.
His actual name was Cliff?
Commissioner Moak.
I guess just one other thought, something that Commissioner Wesley made me think of. I also feel like, not to over dramatize or put too much on this, but I do think this is a moment in time where we could probably reinvent ourselves a bit.
Correct.
And, as we continue to see things possible today, whether it was through COVID or just technology, other ways that, whether it's businesses or even nonprofits, are doing today that they weren't. And I mean, we can have now functional, Dr. Kasire is not here, but functional physician visits on our iPads now. Whereas, like, if we would have said that 6 years ago in here, been like, what are you talking about? You can't, that's not possible. So I just, I don't know. I almost think of the movie theater phenomenon, that movie theaters were gone. There was nobody that was going to go to movies anymore. And then they reinvented themselves and figured out how to keep people coming, whether it was it was mostly booze, let's be real, but but food, and just made the environment different and made it easier for people, right? So I guess, I know this is a short time frame, and I don't know if a complete reinvention is possible, but I would just love us to look at not doing it the exact same way. Yeah. I mean, and I will fight. I've been on this commission for a long time, and we have done that. We have just pivoted just enough to figure it out, and I think this is a time, I think, when we see it this way, and how the future looks, I just feel like our opportunity to do something that is totally different is upon us. So
basically, what you're saying is,
snaps.
Wow, all right. That is so 2019.
It really is.
So basically, what you're saying, if it's not broke, break it.
I mean, I like that book. I don't know if I think that, and maybe it's that we are looking at reserving a portion of our investment to truly shake it up and look differently around how, just even your description about how a family comes in, no wrong door, and navigates their way through. Are there then 3 other steps that a family might be likely to stay on the path to service, wherever that leads them? I don't know. Those are things for really smart people to help us think about. But I guess, what would success look like at the end of the day? Some portion should be reserved for doing things a little bit different.
It's exactly what you all did in the last strategic plan, where you said, we don't know what we're going to do with this racial equity money, but we know we want to put it here because we know we're not getting new partners to the table.
Right.
We know we get the same players over and over again. So let's reinvent it. Let's figure it out. The strategic plan we're in right now is like miles different than the one beforehand. And we have that opportunity. And now we have a precedent for doing things differently. So I love that y'all aren't afraid to do things differently. It's exciting.
Yep. Good comments. Great. Thank you. All right. Your presentation is concluded.
Yes, sir.
Okay. Any other questions for staff or comments from commissioners? Okay. Madam Clerk, do we have anyone sign up to speak on the matter?
No, sir, we do not.
All right. Very good. This was informational. Appreciate the time and energy you put into the presentation. We are on to item number 10. This is another presentation, evaluation of findings from efforts to reduce African American child deaths. And I do have one speaker slip here. So if there are others that wish to address the commission, I would encourage you to get your slips in and to the clerk. That way I can call you in the order that we received them.
Fabulous. And we have Linda Fong Samara is going to kick off this item. She has been our lead on all things reducing African American child death for a decade now, I believe.
Great, thank you.
There she is.
Good afternoon, Commissioners. Thank you for the opportunity to provide you with our fiscal year 2020.
I don't think your mic's on.
Sorry. Okay.
There you
Can
go.
you hear me? Okay. Thank you. Good afternoon, Commissioners. Thank you for the opportunity to provide you with the fiscal year 2023 to 24 reduction of African American child deaths, or RAACD as we call it, annual report. And so, as Julie mentioned before we get started with our presenters, I just wanted to provide a brief introduction and kind of level set for those of you that may not have been here with us earlier on in the journey. It is absolutely hard to believe it's already been a decade since we have officially started this work. Time sure does fly.
Actually,
right?
it's been more than that.
More than a decade, yes. More than a decade, but it's been a decade since we've been funding some of this work. For the commission, it's been a little bit more than a decade as well. This has been, an outstanding countywide effort to really work on and address that continued disproportionality in African American child deaths. And as you mentioned, Supervisor Cerna, those initial conversations began as early as 2011. As a group, as a Blue Ribbon Commission, we went out into the community and had community listening sessions and really began looking hard at that data and looking to the community for information on and input on what the data says and what strategies we might be able to work on in the community. And so this long-standing effort, I think, really has been successful because of our investment in the collective impact framework. And we really are in this community breaking down those silos and working together on a common agenda, on common shared measurements, continually communicating with each other, trying to employ strategies that complement each other, and we have backbone support through the Sierra Health Foundation to really help keep this effort moving forward. And we're fortunate here in Sacramento that we utilize a two-pronged complementary approach. One is the First5 Sacramento RAACD efforts, and then the other is the Black Child Legacy Campaign, or BCLC. So I have to apologize, there's a lot of acronyms in this work. But it really is that complementary effort that's been going on for over a decade that has been, again, supporting that collective impact framework and collaboratively moving those efforts forward. I think that something else to consider is that there have been really two key drivers to this work. It is data and the community voice. And as I mentioned earlier, we did those community listening sessions over a decade ago, and what we heard resoundingly from the community is that they wanted to not only be directly involved, but be a part of the solution and really lead the efforts. And so we hope that as you look through the upcoming presentations, you can see how we have really intentionally tried to honor community voice and that expertise in this effort and really honor and value that in the work. The other component is we know that disaggregated data, we're lucky to have a child death review team here in Sacramento County. That disaggregated data has been key to this work as well. Data is really important in that it can tell us part of the story, can tell us what's happening in the community, can tell us where we might be successful or need to make some shifts in the work and change course. We need to continue the course of these two drivers in our work moving forward within that collective impact model. In a recent meeting with partners that we brought together, we were talking about the data that you're about to see, and we all agreed that while we certainly have set goals that we have worked towards and continue to work towards, this is not a one-and-done effort. Communities change, needs change, factors outside of our control like COVID can happen, and the approaches may then need to change as a result. And so we need to stay committed to this course. We need to continue to plan, implement, reflect, adapt, evaluate, start that process all over again. And of course, we're all here because we keep children and families at the center of our work. And unfortunately, racism continues to be a public health issue. And we can see how those disparities are magnified during times of crisis. And so you will see that in some of the data today. And as we continue to work together and see the progress of these efforts, it really underscores the importance of that targeted but universal approach. While we frame this initiative as focused on African American children, as it certainly should be, we are also needing to acknowledge that the changes that are and can happen in our programs and our services and the systems, they're not only going to have a positive impact on African American families, but children throughout Sacramento County. So again, that targeted but universal approach is so important for all families in Sacramento County. So with that, I'd like to introduce our presenters for today. For today's item, we'll hear from Jadida Gomes of the Sierra Health Foundation, representing the Black Child Legacy Campaign. She will provide you with some updates on what's happening at the community incubator leads throughout Sacramento County, followed by a presentation from Alyssa Mullins of Applied Survey Research, ASR, our evaluators, and she will provide some updates on the First5 Sacramento funded programs, as well as some of our countywide outcomes. We have a lot of information to cover, so we'd ask that everyone please hold their questions till the end of the presentation, and we will answer them then. We also have many partners in the room that can answer some questions as well.
Great, thank you.
Thank you. So, Jadida, would you please come up? Thank you.
Thank you.
Okay, there we go. Half the battle is always figuring out the clicker. So, good afternoon, commissioners. It's good to be here today and report on the incredible work that we do. My name, as Linda mentioned, is Jadida Gomes, Program Officer for Black Child Legacy Campaign at the Center Sierra Health Foundation. And so we get to be the backbone agency, but intermediaries between you, First5 staff, and our incredible partners in the community. So gratitude for your continued investment. Definitely want to underscore continued. To be able to have a county invest in such work for 10 years is incredible and is something worth commending and reflecting on. So we appreciate that. Such incredible, impactful, but also life-altering work. Unfortunately, if we don't do this work, we lose children. We lose families are negatively impacted, and so we thank you for that work. I always have to bring our trusted partners in the room. Some of them are here today, but we do not get to do the work without your investment, but also with the continued commitment and execution from the folks in the community, which, if I can be honest, they were doing this reduction of African American child work before we came together as a collective. And so they were spaces that were trusted. They were individuals that the community knew. I'm not sure what we're gonna do, but if we can call Miss Jackie, if we can call Mr. Roberts, if we can get to Mutual Assistance Network, then some relief will come. And so I always make it my point to lift them up and to bring them into the room, because this work does not happen without trusted partners. We all can try to do this work, but the community doesn't engage with just anyone, right? And so for them to have built the equity in the community and to continue to create spaces where folks trust themselves to return and be served, but also to refer other people to be served is incredible. So we have folks from all the way in Foothill Farms, North Highlands, all the way to South Sac Christian Center. And this slide just highlights the expertise that they each have. And we did this so that we can share just the strength in the model, right? That everyone does not have to be an expert in everything, but because of our collective, we cover those bases, and so our families are served, and I've heard it mentioned before, in a holistic way. So the whole family is not only served for certain needs in isolation, but that they can receive everything they need so that they are stabilized. So just want to uplift that. And so the work that we do is rooted in community. Our partners, and I would dare to say the most important aspect of what we do. They're in the community, they see the families, they service the families. And so we rehearse this over and over, right? That the work that we do is community-centered, it's community-driven, but it's community-serving. And so if what we're doing is not actually translating to the community, we have to pivot. We have to shift how we do what we do so that it can achieve what we're wanting to do. I'll go to the next slide. The importance of this web of partners that we have developed has also created space for additional partners. When we first started 10 years ago on the ground, but over 10 years in planning, we had our core county and systems partners and First5, but as we have developed the work, we've brought in other partners. And so we have community wellness responsive program, understanding that we're serving whole families, we're serving whole beings, and so the mental health aspect and the wellness aspect is just as important as being able to access the benefits from Department of Human Assistance, right? It's just as important as being able to access the advocacy that comes through Child Protective Services. And so our motto has created room for a deepening and a widening of that partnership and that web that is serving the community and executing impactful work. And so I just wanted to uplift, right? We're now in most of the school districts. We're providing advocacy work through Black Parallel School Board. We're supporting with Harlan Child and Family Services. We continue to bolster up this bag of tools that our community is so in dire need of. We often say that because the Black families are facing multidimensional barriers, our solutions have to be multidimensional. And so we cannot serve the community in silos, in isolation. We have to begin to interweb what we do. And so we offer intensive case management, but not just through our CILs, right? We partner with the FRCs, we partner with other agencies that may have other resources that we do not have. Systems advocacy is happening on a broad basis, but also in engaging with the various aspects of our strengths within our network. There's mentoring happening, and I'll get to this a little later, but sometimes our entry points to serving children serving families that have children 0 and 5 is not a pregnant mom, right? And so we have to be nimble in being able to identify how do we have entry points into the community and into families so that we can serve our most needed community. So these are some of the numbers of what has happened over the last year. We have been able to refer 168 individuals to prenatal care. We've been able to support 265 pregnant women. Again, speaking to this trusted environment and to the trusted network that they feel that they can come to one of our CILs and get these services. Safe sleep education is one that we've had to adapt and pivot. We found that quite a few of our caregivers and family members didn't want to sit through a PowerPoint presentation, right? And so our community has been innovative, and they've created, I know for the Black community, if you can gather, people are open to what you have to say. And so we've given them baby showers, just different community gatherings where they come and they know that, one, they can engage in fellowship and community, but then because they're there already, we talk about these very important things. How do you sleep your baby? What support could you need? What resources do we need to get to you so that you can continue to do this work? And so I just want to elevate. We started with one baby shower about 1.5 years ago, and in the past year we've had 4 baby showers across all of the neighborhoods. And so we're paying attention to what it is that is working, what it is that our community is responding to, and providing those services. Because of that, we were able to distribute 89 cribs. And this is just speaking from our CILs. So there's great work happening beyond our CILs, but just wanted to underscore that. And here we also highlight the other offerings that we have available. And I wanted to ensure that we underscored the importance of that to what I just mentioned earlier, that sometimes we don't get the pregnant mom, or we don't have the caregiver that comes in with a 0 to 5, but these other offerings that we are that are in the community are creating opportunities for entry points. So when they have youth-led activities, we're talking about all the 4 cause areas, right? So they're hearing about this, they're being educated, but also becoming more open as we realize that we have to develop and build trust in our community. And so just wanted to highlight that. But we are doing some specific work. And so I wanted to highlight our partnership with the Concrete Needs Program, which I'm sure you all have heard about. So in partnership with DCFAS, we were tasked with serving families who had children 0 to 5 years old, or pregnant adults or pregnant youth, and to be able to serve them with concrete needs so that they could be stabilized, and then we can serve them for it further. And so these were identified in the same way that our CIL neighborhoods were identified. They were areas that needed the most services. These zip codes were experiencing the most entry points into CPS. And so from that point, we identified again, if we would go back to our slide, the trusted partners in those neighborhoods. And so they were trusted with getting these resources out to the community when most needed.
I just want to say that, and this goes back to, I think, your first slide, but what you just mentioned about the geography involved, and it's important to remember the history of that. The history of that is that those 7 communities, certainly, it's undisputable, that's where the need is the most. Mm-hmm. But it was back in 2011 where the data was telling us black babies and young children were dying at these enormously disproportional rates. Mm-hmm. And that's where the heat maps, came in. We looked at 20 years of data. That's where the disproportionality was excessive. Yes. So it's important to not, I think, just acknowledge rightfully that, yes, there's absolutely, that's where the need is. But the most profound part of all of this, right, it's where kids are dying that shouldn't be dying. Mm-hmm. We need to be as blunt as that to remind ourselves what this is about.
Yes, thank you for underscoring that. Yes, so with the concrete needs, one of the things that we realized that it's difficult for families to think about, how do I execute what I learned in Safe Sleep? How do I make a sound decision when you're under stress? When you're thinking about, I don't actually have a car, and my children we don't live in the same neighborhood because of housing insecurity, so I can't get them to school. Or I can't get to work, and so I lose my job. Where am I going to feed my children? And so this program is unique in that way that it does something that feels small but isn't small at all. It stabilizes folks to be able to breathe, to have a moment of respite, and to begin to think through, okay, now that this is taken care of, now that I know that maybe I'm not going to lose my house, or that I don't have to walk all over Sacramento, what can I do to provide my family with the appropriate things that they need? And then it's coupled with, because of the web of partnership and our network, case management work. So they not only help with the immediate needs, but remain committed to those families and walk them through, so that they're not only stepping out of crisis, but building a sustained stability. So this program has been exceptionally impactful and beneficial, and you'll hear from a family member who has benefited from this. And so what do the numbers look like? We have folks across 4, to your point, Supervisor Cerna, Commissioner, sorry, presenting to different audience. They we identified 4 of our partners in these zip codes that were identified where the entry point was the highest, and so the risk of death also highest. And they have been working with these families throughout the year, and a total of 363 families have been stabilized. I'm gonna pause because I think that's really easy to just gloss over and to stop, but what if those 363 families meant 363 youth that did not die, right? I think that it is incredible work that we have to highlight, that every step and every prong of the work is equally important. And so this is just the how the work is being translated across the different neighborhoods. And these are the dollars, right? So far, this is how much we've been able to invest into the communities. And as you see, some of the most needed is immediate support with rental assistance, mortgage assistance, transportation, just essential furnishing, things that we don't think about on a day-to-day, but definitely can be very disruptive as to how you manage your household and how you care for the folks in your family. And so just again, highlighting some of those needs. Total, we have been able to support with $787,000 for these families, whether it's hotel stay, groceries, clothing so that they're able to go to school and childcare, emergency hotel stay so that we can support them into permanent housing. So this is the incredible work that your decisions are making possible. All right, so that was our program highlight. And then I want to talk about 10 years into the work, right? I think that is worth celebrating, but there's some things that we probably can learn from doing something repeatedly for 10 years. There's certainly success, as we've seen in the first few years of execution, that we were able to incredibly decrease the deaths that were happening. And then we were thrown with some wrenches with the pandemic and other factors. But I will say, although the pandemic definitely brought up some challenges, it also identified the strength of the network. And so when we needed to provide care, when we needed to provide groceries, we didn't have to think about, how do we do this? Who do we go to? Who will the people listen to when we need to do education on vaccines and so on and so forth? And so the network pivoted to provide what was most needed in that era. And so I think that it speaks to the strength of what it is that you're investing in, that although our 4 areas are, our areas are those 4 causes, that it serves families much deeper and beyond those causes. When other challenges arise, we know where to go and how to execute and with who to execute that to. So that's the proven pathway, right, to community. We trusted folks that the community can continue to approach. The systems change that's happening, and I'm sure someone else will share about this, but we've been able to connect with healthcare agencies, and now it's normal, right, that you don't really leave the hospital without having first heard about safe sleep education. Those are systems change that we are very proud to say that we partnered and had a way in making those happen. And disparities have also shifted, right? We were able to impact those numbers and have seen an increase in some of those, and we'll need to pivot and to re-strategize, but we have seen preventable deaths happen, and so not happen, and so that's something to be able to relish in. And then the expanding of the reach. We are very close to being able to publish our RFP for the 8th site. And before the end of the year, we'll be able to say that we have an 8th site in Rancho Cordova. And so the work that we've seen be successful in those 7 neighborhoods that were identified over 10 years ago, through research and through data, we were able to identify a new zip code that is much needing the work of BCLC in partnership with First5. So our commitment remains the same: community-driven, community-serving, And we will continue to do this work. We are revisiting some things. Actually, let me go back. Nope. What we find is that with the climate now, we have to be attentive about how we do adjust, right? During the pandemic, we heard often the adage of, when everyone catches a cold, the Black community catches pneumonia. And so I think that is often true with other populations that are marginalized. And so now as we see that the targeting is taking place, we have to be prepared for that, for some challenges that will be more difficult challenges for our community and the folks that we serve than others. And so we're looking straight on to the challenge, but feel equipped, because during the pandemic and the added challenge that came there, we felt equipped. We felt ready to stand up to those challenges, and we will continue to do so. We find ourselves at the crossroad of a new strategic plan. Some of you may know that the data and the goals that we had set were up to 2020. And so over the last year and a half, we've had much research, so in partnership with ASR, with our internal learning and evaluation team, but also the community. We didn't want to rush through this strategic plan, as it needed to be informed by the community. We often say that those closest to the problem, or those closest to being impacted by the problem, are the ones who know what the solution needs to be. And so this was important, that we didn't rush through the process and just making up some new goals that maybe looked good on paper and were consistent with data, but were not sensitive to what the community said. And so we've had a few town halls and listened to what the community has said they need, and in additional to our four cause areas they have brought up. Yes, these cause areas are important, but we're often interfacing with housing, the housing crisis. We're often interfacing with just stressor and mental health issues. They're often interfacing with these factors that keep them from being able to succeed in those four cause areas. So that you'll see very soon, we'll share with the board of supervisors this new strategic plan that takes all of that into consideration, as again, we are serving and supporting families that are multidimensional, right? And so our solution has to reflect that. Yes, and then the other, this is a soft launch, so I won't get too much into it, but thinking about how do we not only reduce percentages, but begin to actually tackle to eliminate the disparity altogether. One of our steering committee members mentioned, if we can't eliminate all deaths, right? At the very least, all deaths of Black youth, at the very least, the Black children should be dying at the same rate as everybody else. And so we're making the shift, understanding that any child dying is absolutely egregious and nothing will stand for, but beginning to truly lessen that gap, so that whatever everyone is experiencing in Sacramento County, at least we know it's not just the Black community, everyone is, and then we can tackle that together. But there shouldn't be the case where we can actually say, right, that when Black children catch when the general population catch a cold, that Black children are catching pneumonia. And so that's the strategy that we're gonna take going forward, deepening our commitment to the community, deepening our commitment to this work to eliminate the disparities and to eliminate African-American child deaths, and also to move beyond response into building healthy, thriving communities. I think that it's important to definitely focus on the identified problem, but we need to think beyond the problem and think about what is the ideal. And I think our Black families deserve to have united, unfractured communities who are healthy and thriving. That is my presentation. I think I'm just going to ignore the slide because they said your questions should wait till the end. But if you have any comments, I'll open it up for that now.
Thank you. Great presentation. I really appreciate what you had to stress there during the last couple minutes of what you presented, because I think it's worth noting that, at least my perspective on things is that when we first had the launch of RAACD effort and the Blue Ribbon Commission, and it stemmed from a child death report and 20 years of child death reports, I think we all kind of approached it from somewhat of a clinical perspective. In other words, we looked at the data, right? And the data was, the metrics were, both percentage and actual numbers of deaths, and we had to do it that way at the time because that's what precipitated, all the attention. The rightful attention was, wait a second, we've had these data sets for 2 decades. What has Sacramento County done about it? And it was crickets, right? So I'm really encouraged to hear you say that the new strategic planning that is underway is, I think, going to be perhaps less clinical in terms of maybe doing deeper dives into prevention or really understanding what the nuanced part of the families that have suffered from the disparity traditionally are telling you, or telling the center, telling all of our CBO partners, telling the county. And so I think it really needs to be amplified here that there is a kind of a self-reflection on the entire effort that's occurring to understand that, hey, you know what, we set a goal, we wanted to hit a certain percentage reduction mark by 2020. We did that, we exceeded it. But I don't think it necessarily has to always be an arithmetic computation in terms of how we determine success. It can be these important anecdotal compliments that help us understand how to kind of circumnavigate the entire issue. Yeah. And it's not just, the black and white of death and alive, So great job. I would be remiss if I didn't just publicly thank again Sierra Health Foundation, the center, especially Chet Hewitt, who has been just an incredible individual and organizational partner throughout the entire, I'm not calling it 10 years, I'm calling it whatever it is, 14 years. And so I really do appreciate, what you've had to share here today. And I'm going to now be quiet and open up the door because I got a commissioner that needs to use the restroom real quick. So, anyone else have comments?
Okay, I have a couple comments and maybe or blended with questions. One, I just want to thank you for this last slide because it's aspirational, and when you operate from a stance of operational, you move differently. So that very last bullet that says legacy forward, it just is everything. It's where the movement is going. So I just really appreciate that, but still underscoring the reality of where we're still needing to, mitigate for those gaps. Yeah. But I was curious for the 363 families and, serving them at the cost of the over $700,000. How long does it take the families to stabilize in the programs? How long do we hold them and stay with them was one of my questions. And then I also realized there are a lot of families behind vehicles, behind rent and mortgage support. They're needing help with transportation. Yes. And I did a program here in Sac County when I was at Child Action. It was the Welfare to Work under the 1996 Welfare to Reform Act during the Clinton years to get folks from the pipeline into the child care industry, but was coming off the welfare system. And one of the number one barriers was 2 things. It was child care, so they could work and do the program. And the second one was transportation. And they had vehicles sitting in their apartments, their mama's house. They had vehicles, but they were inoperable. And what I did was able to hook them up to American River College to their automotive department. Because they were needing to fix cars and needed to work on something. And then here are these cars we're needing to. And I was like, wait a minute. Let me put them together. Now, we couldn't get tow service and all. We had to figure out I won't tell you what I did, but we figured out some things to get the car to ARC.
Yeah.
But my mind is like, okay, how can we bridge that gap? So I was curious about, do they have vehicles that just need to be worked on? And sometimes they just need an alternator or a dead battery or tires. I don't know.
Yeah.
So it's a lot in there. I'm sorry.
No, you're fine. So I'll address the last question first. Yes, I think all of the above. So some of them need vehicles just in general. They find themselves with multiple children and you don't have a vehicle at the moment because of whatever barriers have happened. And other folks, to your point, have vehicles that are functioning but may, need to resolve some issues with motor vehicles, or they need to have their vehicles fixed. And so the array of what the need is when it comes to transportation is so variant. I'll leave it to one of our partners. She can share deeply. I think they're coming up later to share that. But yes, so I think our community partners do a great job at identifying those places like ARC, or even you'd be surprised how many partners we have in the community that are mechanics that are willing to work and support. But there's always this gap of like, how do we get it towed? Or if folks are only paying us, charging for the actual parts, how do we get that paid? And so Concrete Needs has been able to support in those ways, because if you're having to pick between, do I eat or do I pay for the parts for my car to get fixed, the choice is clear, right? So all of the above. Then the other question is, they will stay, our community-based organizations will stay with the families for whatever time is needed. And so sometimes it's a few months, for some it's a few years, depending on what it is that they need, because again, the barriers, if you remove one factor, but then there's still about 5 more that they're having to navigate through. We have to sort of work through it one bite at a time. Yeah, so they are committed to working with the families as long as they need to be served. Any other comments? Okay.
Comments from commissioners? Great.
Thank you.
Thank you again for the presentation. Okay. I do have some speaker slips here, so I'm going to call, unless there's another part of a presentation.
There is the data part of the presentation.
Of course there is. I'm just eager to hear from the public, sorry.
I know, sorry.
No disrespect.
Alyssa will get us through it.
All right.
It's okay. I mean, we can skip my part too. It's all right. Hello, everybody. I will wait for that to pop back up. All right. And I will try to keep it brief so we can be mindful of all the speakers that we want to hear from as well. So as Linda mentioned, I am Alyssa Mullins. I'm a senior project manager representing Applied Survey Research, the external evaluator for First5 Sacramento. Today we're sharing our AACD program outcomes for the fiscal year 2023 to 2024. We'll do a quick wrap up of the 3-year outcomes as this fiscal year is the end of the 2021 to 2024 3-year strategic plan as well. And then we'll conclude with the most recent countywide rates of child death, which these programs aim to help reduce. The RAACD initiatives emerged in response to the Blue Ribbon Commission's reduction goals for the leading disproportionate causes of preventable deaths for African American children. First5's investments focus on the first 3 for the 0 to 5 age range. So that's the deaths due to infant perinatal conditions, infant safe sleep, and child abuse and neglect homicides for the ages 0 to 5. First5's 2021 to 2024 investments focused on funding 4 strategies focused on serving Black and African American communities and those living within the RAACD focal neighborhoods, including the Black Mothers United Pregnancy Peer Support Program, 2 programs within the Birth and Beyond Family Resource Centers, including the Man Arcade Stronger Families, Stronger Generations, and the Valley High Village Program, the Safe Sleep Baby Infant Safe Sleep Program, and a public perinatal education campaign. First, we'll start with the Black Mothers United, or BMU, Pregnancy Peer Support Program. BMU aims to lower the Black infant mortality rate, improve birth experiences and birth outcomes for mothers and babies, foster safe and empowered pregnancies and transitions into motherhood, and improve access to risk-appropriate and unbiased health services. Participants receive weekly check-ins with pregnancy coaches, as well as doula care, lactation support, health resources, and group connections. In the words of this participant, I like being in a group setting of moms where everyone looks like me. I don't feel isolated. She also shared that she still reaches out to her pregnancy coach for advice, even though she has completed the program. Nearly all of the participants who entered the program during the fiscal year had at least one protective factor, such as receiving regular prenatal care, enrollment in WIC, or if eligible, enrollment in CalWorks. 84% had at least one health or socioeconomic risk factor that is measured, which can include, but not limited to, income less than $15,000, unstable housing, health, nutritional deficiencies, anxiety, depression, things like that. More than half lived in one of the RAACD focal neighborhoods, and about 1 in 5 joined during their first trimester.
Can I ask a question real quick?
Yes.
Has there ever been application of like an ACEs score for any of this?
Good question. I don't know if there's an ACEs specific measure.
Because what you just mentioned line up naturally with ACEs.
Yeah, I don't know if ACEs score specifically. Do we have?
It's not one of the current assessments that.
No, we use PHQ-9.
Mm-hmm.
We don't use but we have a part of our annual trainings. We utilize that to support and educate staff so that they can pick up on some of the tools, but yeah, we use PHQ.
Could be something we could consider adding as an additional assessment.
Like Commissioner Moak mentioned, I'm just listening to some of the parameters, and they're like, well, she's rattling off the kind of the ACEs indicator. So maybe
I'm sure all the hardworking staff, they want more assessments to begin. So you're welcome. We're just adding on more paperwork for you in
I swear,
real
every
time.
year I go to them, I'm like, do you want us to cut some things? I swear, we're happy to do it.
I know.
Sorry to
All
interrupt.
right, no worries. Sorry, I'm trying to rattle fast, and I'm okay. So as part of speaking of more assessments, as part of the postpartum check-in, BMU participants who delivered during the year are asked to complete a follow-up assessment, and we did see overall improvements in the matched responses, including statistically significant increases in WIC enrollment. While not statistically significant, I did want to highlight the 10 percentage point increase in CalWorks enrollment, the 7 percentage point decrease in self-reported anxiety, the 5 percentage point decrease in participants with moderate to severe PHQ-9 scores, and 5% decrease in self-reported nutritional deficiencies. Also of interest is while you can see the self-reported depression percentage stayed the same at 18%, what happened is the individuals reporting depression at intake, most of those said no at follow-up, whereas the people at follow-up said no at intake. So it actually can open the door to conversations around rapport and disclosures with the pregnancy coach over the duration of their program, as well as postpartum depression screeners, postpartum transitions, and mental health in those early stages of parenting. Transitioning to birth outcomes, there were 66 BMU infants born during the fiscal year, and for the 5th consecutive year, there were 0 newborn deaths as of program exit. More than 90% had at least one of the healthy birth outcomes measured, and when combined, 85% were both a healthy birth weight and full term. This year, none of the infants were both preterm and low birth weight, but a small number were either low birth weight or preterm. And we saw promising results for those whose mothers were served by a doula, with 24 out of the 26 infants born, both a healthy birth weight and full term. In partnership with Public Health, we also looked at 12-month infant mortality outcomes for infants born to BMU participants during 2020, 2021, and 2022. During this 3-year period, there was 241 BMU births and unfortunately 1 infant death. This individual represents 0.4% of the BMU births during this time frame and equates to a numerical rate of 4.1 deaths per 1,000 births. With this individual infant, the BMU infant mortality rate per 1,000 births was not only much lower than the countywide African American infant mortality rate of 12.0 per 1,000 African American births during the same period, but also lower than the countywide total during the same period of 5.2 per 1,000 births. And we've actually been looking at the same data beginning with 2016 births. So just to highlight how rare this unfortunate passing of this infant was, in the combined 7-year period between 2016 and 2022, there have been a total of 3 BMU infants who have passed away in the first 12 months of life out of a total of 1,085 births. So that's 0.3% of the infants. I think that just really speaks to the value of pregnancy peer support initiatives like BMU, especially for African American families and mothers in Sacramento County, which can be highlighted here by this participant's quote, who says, "I was so blown away by how kind and loving the environment was. I felt so welcomed and seen for my skin color. They care deeply about the Black community. They give so much." Next, Birth and Beyond Family Resource Centers provide a range of services to empower communities and support family well-being. And the Man Arcade Stronger Families, Stronger Generations program and the Valley High Village program expand on this by connecting African American families in culturally practical and beneficial ways.
Can I ask?
Yes.
Maybe there's a question for Julie. Why isn't the FRC in South Oak Park receiving RAACD funding?
I'm sorry, why isn't which one?
If I'm reading this correctly on the slide here, it says
Yes.
only 2 of the 9.
Yes.
We know that 95820 is one of the highlighted community, there were zip codes,
Right.
which includes South Oak Park, and we have a FRC that is a centerpiece to the Fruit Ridge Community Collaborative. So I'm wondering why isn't funding being offered directed to that FRC?
Good question. This is really a sort of a holdout from the original funding when about, was it 10 years ago, 5 years ago? Probably 10 years ago, actually. It was 10 years ago. It's right before I started. The commission looked at the Black infant death rates and selected the 2 areas that have the highest rates. That was Arden Arcade and the Valley High area. And so those 2 we did. There was no FRC in Arden Arcade at that time. So this commission funded the opening of that FRC, and then there was an FRC in Valley High run by Sac Children's Home, and you all bolstered that FRC to be able to have a separate program called The Village. Over the course of the last 10 years, we did actually one time go out to bid to see, again, we still had very specific neighborhoods that could apply, but those 2 agencies won the contracts again. And were refunded. And when we just did this strategic plan process, we kept what had already been working. And so we didn't go out to bid again.
Does any of this, what you just explained to my question, have anything to do with First5 really looks at 3 out of the 4 leading causes because of age, right?
Correct.
So does that limiting factor have some influence on why those 2 particular FRCs, again, kind of seemed more, I don't want to say relevant because it's all relevant, but it more germane to the 3 out of the 4 leading causes that we're focused on?
Correct.
Okay.
And those primarily were for primarily child abuse prevention, which is one of the main things
Sure.
that our partnership with
The canned
Birth and
homicides is
Beyond-
what you're talking about.
Exactly,
Okay.
the canned homicides.
All right. Thank you.
Sure.
So within these two programs, the home visiting participants increased agreement with the effective Black parenting program home visiting model behaviors, increased protective factors, and increased access to immediate needs. The Make Parenting a Pleasure group parenting education participants improved positive parenting knowledge and skills. We did not have outcomes data for the participants for the effective Black parenting group parenting education participants this year. The participants receiving level 2 crisis intervention case management showed increased stability and self-sufficiency in their areas of focus. Through their individualized goal plans set with their case manager according to the Family Strengths Builder questionnaire. And the participants receiving the light touch social and emotional supports participated in activities like diaper distributions, peer supports, and other pop-up and group activities such as a Mother's Day event. Two highlights from our Family Resource Center participants. First, we have a home visiting participant whose fictional name is Sky. She described herself as a Native American mother whose child is multiracial. She was seeking support with child development and parenting skills and was excited to learn about the effective Black parenting home visiting because she wanted to support her daughter's embrace of her African American identity. Through the home visiting participation, she completed the Safe Sleep Baby workshop, connected to Medi-Cal to get insurance for her daughter. She learned about her daughter's developmental stages, and she shared that she is continuing to learn about historical and modern parenting based in the perspective and wisdom of African ancestors. Sky said, "I want my daughter to know as much about African culture as she can, and I wanted to be able to learn from Black women." Our next participant participated in the crisis intervention case management, and we will call her Imani. Imani was fleeing a domestic violence situation and living in transitional housing with her 4 children between the ages of infant to teen years. She reached out to the Family Resource Center for housing support and was initially connected to the home visiting program when she through that process, realized that the case management process was a better fit for her needs at the time. Through the case management process, she was connected to a holiday gift registry, food boxes, diapers, and a micro transit program, which helped her save up to eventually get her own car as well. She also received housing leads, which resulted in her getting selected for income-based housing lottery, and at the time of follow-up, she was getting ready to move into her own place and said that she is still using Family Resource Center support for things like activities and diapers here and there. Our next program is the Safe Sleep Baby campaign, which aims to facilitate knowledge and behavioral change about infant safe sleep practices to decrease infant sleep-related deaths. During the fiscal year, more than 1,000 caregivers received the 1-hour education workshop. 61% lived in the RAACD focal neighborhoods, and about 1/3 were African American. And more than 600 cribs were distributed, and 1/3 of those went to African American participants as well. As this participant says, "I feel more confident keeping my baby safe while she sleeps. I didn't realize it was such an important topic, but now I do, and I also have a safe place for her." And in addition to direct services provided to families and caregivers, more than 200 community-based service providers and 70 healthcare workers were trained in facilitating the Safe Sleep workshops, and Safe Sleep Baby education continued to be implemented in all of the main birthing hospital systems in Sacramento County. Each year, Safe Sleep Baby conducts follow-up calls with a sample of participants to ask about their practices following the training. When we match their reported intentions prior to completing the workshop to their reported practices, intentions matched to their practices after at the follow-up call, we saw overall improvements for the key safe sleep practices. African American participants were significantly more likely to report always sleeping their baby on their back at follow-up compared to before the workshop. And while not statistically significant, at least 9 out of 10 African American participants reached for follow-up were exclusively sleeping their baby in a crib or pack and play. Now, in the 2021 to 2022 cohort, we saw a slight decrease a couple years ago between that intake and follow-up with the sleeping in a crib or pack and play, which led the Safe Sleep Baby staff to do some outreach and focus groups to identify some of the challenges that families were facing using that pack and play. They were able to identify some opportunities to improve their trainings and the narratives. And in the 2 cohorts that we've seen since that 2021 to 2022 cohort raised these questions, we have seen improvements in both cohorts since. So that has been impressive to see that in action. Our last strategy is brief because the 23-24 was the final year of funding for the perinatal education campaign, so the activities were primarily focused on wrapping up. But this strategy included 2 major branches, which are the SAC Healthy Baby and Model of Caring, which was formerly the Unequal Birth Campaign. In 2023-2024, the 2 strategies were merged onto one website, and the team created tools to help providers connect families to resources and to help medical providers and birth workers understand the racial biases and discrimination that Black women experience in order to reduce the likelihood of negative birth outcomes. And I just want to highlight for this program that personally, I have been really impressed in seeing how this campaign evolved over the past 3 years in centering community feedback and combining both individualized stories as well as data-driven statistics to not only reach and empower individuals, but also to connect with providers as champions for change at a systems level. And I look forward to seeing how the partners incorporate what they've learned over the past few years into their organizations moving forward. Before we move on to the countywide data, just to wrap up with some key takeaways for these 4 programs overall. The program participants often lived in the RAACD focal areas, showing that the direct services are reaching the communities that have historically shown the greatest opportunity for support. Participants have gained access to a range of community resources. They have improved protective factors as well as parenting knowledge and skills. Birthing parents who engage in peer support have had healthier birth outcomes and lower rates of infant mortality compared to countywide rates. They have significantly improved infant preparedness and safe sleep practices. They have received more than 1,500 cribs across the 3 fiscal years and have had opportunities to engage in community events, access information online, and have shared their stories in ways that will impact providers and other communities for years to come. And as these 2 providers say, the support is great. I felt heard and understood during this birth and pregnancy, and I know how to protect my baby, which gives me peace of mind. Okay. Now, as we transition from program highlights into countywide trends, I'd just like to stop and pause to acknowledge that the language that we use when we talk about trend directions and goals and rates can appear to situate things like child deaths as just data or units of analysis, rather than the actual human cost and consequences that the families and the communities and our direct service workers and the child death review team navigate at a more personal level. So even though our work focuses on this quantitative lens, I just want to start by recognizing that we all know in doing this work and in this room and outside of this room that we know that these are not just numbers and statistics. These are children and families that are impacted and that continue to motivate this community impact model. In addition to that, I also want to situate us in the context of time. So we're now stepping back a little bit further, as the most recent data in the calendar include the calendar years 2020, 2021, and 2022, which of course are the height of the unprecedented COVID pandemic. So in addition to the physical implications, COVID created lasting and numerous social, economic, mental health, and more ripple effects. And of course, these disproportionately affected communities of color and compounded existing inequities. So if we look at our table here, we see each of the Blue Ribbon Commission goals to reduce racial disparities in child deaths for Black and African American children. Since the Blue Ribbon Commission initially set 2020 as the goal year, and since we report data in 3-year increments, our benchmark year is reported here for the 2018 to 2020 period, as that was the first year that we introduced 2020 data. The 2 columns outlined in orange reflects the same information, but for our most recent data point, and then also adds in that column for the most recent year for the percent reduction or the percent change in the disparity gap between African Americans and all others over time as well. And I also want to note that for the purpose of the First 5 report, the percent change in overall death, as well as child abuse and neglect homicides, are reported here for the 0 to 5 population. So if you are looking at reports in the future for the 0 to 17 population, the rates calculations, whether or not the goal was exceeded and what that percent reduction or percent change would be will look a little different as well. So these are based here on the 0 to 5 rate per 100,000 population. And I won't get into this in too much detail since we'll be looking at most of these on slides going forward, but I did want to just kind of bring us back to that conversation about COVID. So if we look again at that benchmark column in the center, even though it does include the 2020 COVID year, 2 out of the 3 years included are pre-COVID, whereas again, that most recent data is very fully immersed in COVID, where we're having difficulty accessing services, just lots of, again, that ripple effect, really widespread impact. So even though we don't have a measure of saying, yes, this is a control for COVID, or yes, this is how COVID impacted, what we can see is that if we just look at those 2 middle columns, we can actually see some regression even in the areas where reduction is still happening. So if we look at that goal of overall reduction, we see that as of 18 to 20, the goal for overall reduction was exceeded at 30%, whereas as of 2020 to 2022, that reduction wasn't as steep at 19%. So it still exceeded, but it wasn't as sharp. And we see that for each of those. So we can say, again, without necessarily quantitatively measuring and including COVID as a variable in this process, we can say that it is likely that COVID is playing a role in this process.
Before you leave the slide.
Yes. Oops, wrong direction. Oop, wrong direction still.
Yeah, this kind of goes back to an earlier comment that I made about the 3 out of the 4 that First 5 focus on, 3 out of the 4 types of death, excluding the third-party homicide. However, the parenthetical at the bottom here made me think that have we done a look back at like the last 14 years, let's say since the county and First 5 began really honing in on the data here, a look back at third-party homicides that do include victims that fall into 0 to 5 subcategories? And my point where I'm going with this is that, yes, I think you might generalize, some might generalize that perhaps third-party homicide generally might involve older children, teenagers, and the adults that maybe commit, unfortunately, the homicides against the older kids. But do we know whether or not there are cases where we have had third-party homicides where the victims have been 0 to 5? And if so, why wouldn't we try to tailor some of the interventions that are generally being implemented through the broader effort outside of just First 5 to focus in on prevention when it comes to what we can try and decipher from the circumstances of those unfortunate third-party homicide instances that involved a very young person.
In most cases, if it's a homicide, it is related to child abuse and neglect.
Right, which
For
is a
that
separate
separately.
category. Yep.
Most, if not all, of the third-party homicide is one child killing another child.
Define child, that's what I'm getting at.
Yeah, like the teenage years.
Okay.
Yeah.
But that's you're saying that kind of
Okay.
not telling me the numbers, right? I wouldn't expect you to have them off the top of your
I'm going to look
head.
at Linda to see if she has them. I don't think we would have them off the top of our head, though.
And if it's the case where it just doesn't happen, I understand that.
Yeah.
But I don't know that for certain.
Yeah, it's a good question. We would probably need to circle back with you and defer to Child Death Review Team. And also, Alyssa, we have a grid of all of the child deaths 0 to 17 and the causes, but I don't recall seeing one for 0 to 5, but I have to double check.
Yeah, again, what kind of inspired me to chime in here is this parenthetical doesn't say ages 6 to 17.
Mm-hmm.
It says ages 0 to 17. So just kind of made me think, well,
Yeah, we can definitely check and see if CDRT already runs that for us and it's 0 every time, or if it's something that we just haven't asked for before to confirm. So we can definitely just make sure, because they do provide, for instance, with the CAN homicides, we get that 0 to 1, 0 to 5, and 0 to 17. So we can definitely just ask to be sure one way or the other.
very good, thank you.
Thank you.
Commissioner Kravitz-Wertz.
Just to that point, I'll say, as someone who works primarily in the youth violence prevention space, and to Jadia's earlier point about the multiple points of entry to the BCLC services, at least where I'm most closely connected, which is our UC Davis hospital-based violence intervention program, all of the case management for both young people under 18, but probably more germane to this conversation, the 20 to 30, those young adults who are the most impacted by third-party homicide, but who have kids who are under 18, including, given that age range, lots of kids that are 0 to 5, are referred to their local BCLC collaborative case management. So I think there are interfacing.
No, thank you for that. So what I'm hearing you say is, based on your very close professional experience and focus on this, is that maybe they're not the 0 to 5 deaths, but they're certainly 0 to 5 consequences that stem from young adult homicide. So again, that's a great point. I think maybe we are uncovering something that perhaps we should have been understanding a little bit better than we have in the past.
Thank you.
All right, we're going to take a quick look at overall infant deaths. Now, this is not an area that's covered directly in the Blue Ribbon Commission goals, but since it is a major focus for First 5, we do cover it in detail in the report as well as in our presentations. So this is our infant mortality rate. As we briefly mentioned on a previous slide, the African American infant mortality rate for 2020 to 2022 was 12.0 per 1,000 births, and that reflects an 11% net increase compared to the baseline, as well as an 8% increase in the disparity gap or the disproportionality between African American infants and all others.
And again, those are COVID years.
Yes, exactly. And we'll also just look at this one particular in a little bit more detail in table form, just to acclimate a little bit more to kind of where these numbers come from, as well as some of the contributing factors to this, as well as another kind of deeper way of looking at this. So a couple things to note here. First, we see that the number of Black and African American births has been declining. So if we look at 2012 compared to 2022, we see that there are several hundred fewer births. So each additional death has a larger impact on that calculated rate. So the total number of deaths combined for those 3 years, for 2020, 2021, and 2022, is 61, which is actually lower than 2012, 2013, 2014, despite that net increase. However, so is the number of births. So we're seeing that net increase in the overall rate per 1,000 births. However, it is also concerning to see that if we look at 2019 in that middle highlighted row, we're seeing a numeric increase in the number of deaths each year, where the 2022 number is actually equivalent to the 2012 number. So definitely something for the county to monitor in terms of the impact of COVID, as well as any other means of intervention.
Is it fair to conclude from this chart that, if I'm not mistaken, I want to say the first years that both the county and First 5 were finally budgeting for this effort, the broader effort to reduce African American child deaths, was 2016, 2017
We actually
timeframe?
started earlier than
right?
that.
15
Yep.
maybe?
15 was, I think, when we became fully implemented, but even First 5 started working on this even before 2015. It's why we used 2012 as the baseline, because that was the year that nothing was going on.
No, I understand, but I'm recalling back from county budget hearings, and I want to say
County
15
budget.
15 was probably the first budget that it made some dedicated allocations.
Yeah, fiscal year 13-14 was when First 5 Sacramento started funding, and then fiscal year 15-16
That's right.
is when the Board of Supervisors approved funding for the CILs and began funding.
Right. So where I'm going with this is it fair then to, and of course, money being thrown at something doesn't necessarily solve anything, but can't hurt. Could we correlate the fact that you see the bottom row there, the numbers go from double to single digits for 4 straight years, and then we get to COVID and it bounces back up, that might have something to do with resource allocation?
I would say it's a fair correlation at minimum.
All right, thank you.
Professional opinion. Don't quote me on it, even though it's live.
Commissioner Moak?
Yeah, I feel this is my annual moment.
Do I need to go to the bathroom?
No. To just, I understand, I've had the, to call it the pleasure isn't the right word, because being involved in seeing what the work that CDRT does and all that comes into it, all the data collection from all the different angles, county process, everything, I would just, again, every year I say the same exact thing with the same presentation and have for probably 20 years now, which is the fact that we're looking at 2022 is not doing anyone any justice at all, right? I mean, in the world we are in today with real time, being able to make decisions based on 2022 data to what we do now would be reckless. We wouldn't do it. We would need to see 2023, 2024. And so I know, I get it. I understand the logistics and the mechanics and the issues and I think I understand it, or at least I've been told why. I just have a hard time still wrapping my arms around with being okay that we are in such a data lag for this topic.
Absolutely.
So
I will say, I think one thing that may benefit us in 2 years from now is that we are actually a little bit even more delayed this year because and I'm going to potentially butcher this for our partners, they might be screaming at me, but there was a grant received that impacted the timing of being for the CDRT team to be able to reconcile the 2022 deaths, because the grant required such quicker reconciliation of the 2024 deaths for that grant. So in 2024, we're going to have the data a lot quicker.
we're in 2025. but I know
Exactly. So, yeah, so
in 2027, we will have the 2024 data a little quicker.
yeah, exactly. So potentially we might be able to look at 2023 and 2024 together. I don't know necessarily, but it absolutely is a challenge when it comes to this work, absolutely. And
I will write my local congressman and figure out how to make it.
you tell him. All right. I know we are well over, and I don't want to breeze through the most important things, but just to quickly highlight, according to our most recent available data, in the most anomalous years, the infant deaths due to perinatal causes spiked in 2020 to 2022, now with a 14% net increase, now exceeding our baseline value and equivalent or comparable to our peak of 2014 to 2016. And unfortunately, this is following a promising decrease in 2019 to 2021, where the rate was meeting the Blue Ribbon Commission goal and the lowest for the first time.
Do we have any background on the specifics and under what the specific perinatal circumstances were that could have been respiratory related, could have been something related with the pandemic?
The CDRT team might be able to share some more details on that when they release their more detailed report, but they only provide us the total numbers, unfortunately, instead of the circumstances of what led them to those decisions.
Again, it leaves at least this commissioner left with the guessing game, I guess, that this is pandemic related. I mean, based on the time and the huge bounce in the wrong direction.
That is where I would be afraid to chime in, but
yes,
yeah.
All right, understood.
Mm-hmm. We also saw a slight increase in infant deaths due to sleep-related causes. However, I do want to point out on this one, it is a little bit of an anomaly as well, because if we look at calendar year, I don't have a table for you on this one, but calendar year between 2015 and 2020, there was an average of about 3 African-American infant sleep-related deaths per year. In 2021, there was unfortunately 7. Which we can potentially say that is likely due to decreased access to those community resources and that kind of more community-based being able to gather and have some of those more detailed conversations about infant safe sleep potentially, among other factors, I'm sure. But in 2022, this actually dropped back down to 3. And as an added highlight, the 2022 county total for all races combined was the lowest it has been, at least for all the data available here. So even though the most recent rate increased, causing the rate to fall just shy of that Blue Ribbon Commission reduction goal, the 2021 anomaly is really kind of largely contributing to that, in addition to those ongoing decreases in the number of births for African American families in Sacramento County. However, it is also important to point out that the 32% net decrease in the disparity gap since 2012 to 2014 still means that African Americans are still experiencing infant sleep-related deaths at 5.5 times the rate of all others. And then our last slide here shows that the reduction of African American child abuse and neglect homicides continues to exceed the Blue Ribbon Commission reduction goal. And again, just to reiterate, the previous slides were focused on infant deaths, which were rates out of 1,000 births, while can homicides are discussed for all children ages 0 to 5. So our rate is out of 100,000 children ages 0 to 5. And we do see some increases in the more recent years, but I just want to be mindful that that is an increase from the very impressive 0 in 2016 to 2018 to a total of 3 in the most recent data. However, again, the disparity between the two groups decreased 57% compared to our baseline data, yet can homicides of African American children occur occurred at 4 times the rate of all others in the most recent data. Thank you.
Great, thank you. And thanks for putting up with our interruptions. It's good to have the data. I think what it tells us, at least the story that it's told me here today, is that a few things. We can't discount the fact that we went through a global pandemic, and that's going to have some influence. We shouldn't treat that as an excuse. Number two, we have seen upticks in certain types of rates of death in the African American childhood population, but those upticks still fall under what the goal was. So we shouldn't celebrate the fact that there have been the upticks for, that's obvious. But we should also keep our eyes on the prize that, we set out specific goals, and we, in some instances, are still below them. But I would also say that maybe that's the indication that maybe it's time to change the goals, so that we get even more aggressive on what we need to be aggressive on. So this is important to understand. I wish the numbers were better. It's not all bad news, but again, I think what it leaves me with is just there's so much more work to do, right? And not just on behalf of the commission, but the entirety of the infrastructure, the human infrastructure that we have, thankfully, in Sacramento County, focused on this effort, that just need to grab another gear and get there. So any other comments from commissioners following the presentation? If not, we will hear from members of the public. Thank you again. All right. First up, we have Kenya, Brittany, and Tamara.
Good afternoon, commissioners.
Good afternoon.
Thank you for having us. My name is Kenya Fakbimi. I'm the executive director of Heart Health First. And then I have Brittany Allen, who is my program director, and Tamara Walton, who is our lead pregnancy coach for the Black Mothers United program. And so through Her Health First, Black Mothers United program, we focus on connecting Black families. We connect with families in the hardest to reach communities. And we just seen this data that told us that we had an 11% increase in infant deaths. And I have to just say that when I looked at that data for the first time, it took me through a range of emotions. I've been doing this work for 26 years, and I have to say that I was shocked to see the numbers that we had. Because I see in real time the efforts that my staff is making, our community partners, all the work that's being done, and then to see that number, it was kind of hits you in the gut. And so in all the emotions I went through, I felt angry at times, I felt guilt, like did we do enough? I felt pain, genuine pain, because each one of those numbers is a baby. And the last emotion that I kind of felt was, and which is one of the hardest ones, which is acceptance. I accepted the fact that the African American community has the largest disparity gap on all levels. And my acceptance did not mean that I wasn't going to continue our fight, right? That change is not happening. It may be slow, but I see the seeds that have been planted in our community, and I believe that this effort is going to progress in positive outcomes, and we've seen some of that. My emotions, along with my team, has given us the gas and the fuel to push forward and continue.
Good afternoon, Commissioners. My name is Brittany Allen, and one of the biggest responsibilities we have is to raise awareness of these devastating child death rates. As we, the Black community, become more informed of the reality that the odds of having a healthy birth outcome is not in our favor, the more we begin to seek out these support services. We look for a sense of community, moral support, and someone to advocate for our well-being in these hospitals. And during the height of the COVID pandemic, many expectant mothers were hesitant to engage with BMU due to safety concerns. And they didn't want to leave the comfort and safety of their homes or have someone come into their homes to provide their in-person visits. However, now that the pandemic has eased, pregnant Black women are seeking these face-to-face support services, and the increase in awareness around the maternal mortality and infant loss is driving them to connect with programs like BMU for that education and those resources that could help them avoid becoming another statistic. And there are not very many programs like BMU, and we build this genuine relationship with each mother. We listen to their needs, and we provide that personalized support that they need. It's not just to ensure the healthy pregnancy, but to make their pregnancy experience a celebrated one. And our mission is for every mother to leave the hospital with their baby in their arms. And it happens too often that they don't. And that should never be acceptable. Thank you.
Good afternoon. My name is Tamara Walton, and I'm kind of speaking on behalf of being a pregnancy coach and being a mom. So 8 years ago, I gave birth to a beautiful little boy as a recipient of the services from Black Mothers United, and now I'm a pregnancy coach. And I've seen things both before. Pregnancy coach. I'm the lead pregnancy coach. Thank you. And I've seen things before and after COVID. I've witnessed firsthand the drastic changes families have faced. Mothers were either urgently seeking support or now fearful of the unknown, especially when it came to how vaccinations might impact them or their babies. Support during deliveries and even routine doctor visits were limited, creating emotional and physical barriers. Community outreaches were either obsolete or very hard to come by, and most were actually drive-through, pick up and go, with little to no connection. So it's only within the past year or two that things have started to feel somewhat like normal again. So, thank you.
Thank you. Okay, is it Toby Tennessee?
So my name is Kevon, Mr. Holmes. I work with Roberts Family Development Center and Black Child Legacy. And I'm one of the caseworkers that upholds the caseload throughout Sacramento. And this is one of my caseload members, Toby Tennessee. He's just going to tell you guys a couple of things about his story and how we helped him and how to help him get through his challenges.
All right, my name is Toby Tennessee. I'm speaking on behalf of my son, Famous Tennessee, that's 3, autistic, nonverbal. He was left with his mom, and his mom went to work or whatever, and her boyfriend beat him and put him on life support for 3 days. And being that I never went through something like that, Black Child Legacy and Neighborhood Wellness, they came together and they filled in the gaps. Like when he got off life support, they sent him home too early. So being a parent, I went back to the hospital and I wasn't leaving. And they came in and then they was my voice because all I want is my son to be back healthy. But the concrete needs, that everything that I needed, they supplied it. And I just want to say thank you.
Yeah, so we was able to provide them different wraparound services. And one of the services that we provided was housing, groceries. I think we changed some locations as well because the environment that he was in wasn't safe. So I believe we went from the north to south Richmond. Not Richmond, Sacramento. And maybe he can give you a couple of other things that we did for the wraparound services. Just a couple examples.
The emotional part, I mean, as far as being there for me and just, I can't describe all the stuff they did, but it was just mind-bothering that, I mean, like, I don't know how to explain it. It's they was there for me, and when I wanted to give up, they didn't just put me to the side. They gave me some counseling, and Famous is doing better now, and I'm just gratitude, my gratitude for them and for all the stuff they did is just, I don't know, it's good. I don't know.
Yeah,
I ain't trying to start crying and stuff.
You got I answer the phone on whenever he needs anything, so I'm here 24 hours for him, and that's the type of dedication I put into my work, you know. So I was able to provide him with all the services he needed to get to the next step.
Yeah, I appreciate it.
Great. Thank you. Appreciate it. All right. Adriana?
Nice to see you. Hello, First 5 commissioners. I'm Adriana Marshall, and this is Hendrix Johnson. Wait a minute, baby. So, working with BCLC since 2016, I was a youth in high school, and then I switched over from to the side of Sierra Health Foundation. But today, I'm going to be speaking through the lens of a first-time mom and a young girl who was born and raised and still resides in Sacramento. I've seen the fruit what First 5 Commission has produced throughout the years, but I have seen both sides of it. I've seen the good and the ugly, from the stories of the hospital and people rejoicing and celebrating their babies to people getting the unfortunate news. Now, Hendrix.
He's going to have that microphone.
Do you have something to say?
Wants to talk.
Do you have something to say now? You say hello? But the good, the bad, and the ugly. And from having the knowledge myself to pouring into my colleagues, to pouring into the people that I'm around, and just pouring into my community as well too, and also having the opportunity to share with people through platforms like social media. Now, the question that everybody is asking is, how do we continue to celebrate those posts of the monumental first birthday that I just celebrated myself, me and my family? And that's by supporting the communities. My belief is that anything successful starts with the family. And our families essentially are what gives us the drive and passion to do the things that we do on our day-to-day basis. Unfortunately, families who look like me haven't had the best outcomes with generational trauma, grief, oppression, disappointment at the hands of so many people, plus the ongoing struggles of today and the uptick in eggs and bacon and everything else. So I thank you on behalf of myself, my family, and families around Sacramento that are striving to break some of those generational cycles and patterns by continuing to provide the services that center to push Sacramento, the loved city of Sacramento, to a united community and to center ourselves to be more united up front. No matter the demographic, no matter the skin color, no matter the story, because again, family starts with us. Those numbers represent our families and the families that were impacted, but I especially want to emphasize our families, because these families could be so dear and near and close to your heart. And I encourage all of us in this room to continue to educate, to pour into the kids, to continue to pour into the little Hendrixes. Because they're going to be young people someday too. They deserve a seat at the table. And that only starts with as we continue to pour into these communities to provide the services. And thank you.
All right, thank you. By the way, that is the most awesome first name. Yes. All right. Danielle Lawrence. And that's the last speaker slip I have.
Hello, everyone.
Hello.
My name is Danielle Lawrence, and I am the Executive Director of Mutual Assistance Network. My aligners in, so forgive me for my lisp. Commissioner Cerna, you started out talking about the timeline, and I've been here from the beginning. I run the incubator in Arden Arcade, which was absolutely funded by First5. It was the 9th Family Resource Center placed in Arden Arcade in a neighborhood that had no formal services. We stepped in, and we still are one of the very few nonprofits that serve community to this day. So what we've done is built upon the charge of Black Child Legacy, of that Blue Ribbon Commission report that led to the funding of Birth and Beyond. We built on that. We then wrote for to be a CIO. So MAN is the only Birth and Beyond CIO. And so I think that that's something to note. The work that we do is built upon the foundation of what your investment was. So not only do we have Black Child Legacy, we have the Family Resource Center that is doing work. Dorisha oversees the Family Resource Center efforts, group-based, Jasmine, home visitation. So when you hear strong families, strong generations, that's these two ladies leading. Brandy is my CIO lead. When you ask them why we do this work, it's because of the death disparity that started this. They don't work in silos. They don't work separate. If you ask Jasmine, does she work for VCLC?
Yes.
And if you ask Brandy, does she work for the Family Resource Center? Yes. It's how we must do this work. When we look at the data, and I promise you, every time I see it, I'm a data person. I'm an outcomes person. So when we see the data not getting better, not improving, I tend to say, well, as a funder, I'd be like, well, why am I funding this work? But the truth of the matter is, it would be worse if you weren't funding this work. It would be that much worse. When you look at the percentage of people we serve compared to the number of African Americans in Sacramento County, we aren't funded enough to touch everybody. So the efforts of our work is built upon each other. I'm going to add that for me, this work is so important. Blue Ribbon Commission report led me back to MAN, led me to lead this work. So add to the work that they do, Black Infant Health is a program that we run and operate. Why? Because perinatal conditions, if I'm going to be intentional, I got to have some funding and some programming to help do that work. And so we wrote for Black Infant Health, perinatal conditions. I will say this, as I see the data not improving for perinatal conditions, that's my area of focus. We have to figure out countywide, what are we doing? Wonderful work Kenya's doing, but that's the work y'all see. There are 2 other programs doing birthing work, and we're not doing it together. It's operating in a silo. There's not a continuum of care. There's opportunity systems to advocate. So Julie, I'll be reaching out. I have some ideas, but like we've been doing this work. We see the opportunities. I'm going to be quiet, make space, and see if anyone wants to share. Brandy is also our champion of all things concrete needs. And so if you do have specific questions around what that looks like, what that has felt like, she has been in the thick of it. We have been in the thick of it. The resources do not meet the need. Just internally to even push out the resources, it doesn't meet the need, but we are doing the work. We're committed to that.
Sure, I'll speak briefly. Thank you for having us. I think the Concrete Needs Program has been essential in the way that we've been able to support. We don't always get funding that we're able to just issue at the request of the family for the needs that they need specifically. So transportation, I love the idea of partnering with ARC. That was beautiful. Some of the other areas that came up around transportation was families would have a financial hardship for something and now they're behind on their car payments. Or they can't afford their insurance lapse, and now they need insurance, and now it's way more expensive to try to get new insurance. So those are other ways that we were able to support transportation, just to answer your question earlier. And so just being able to provide financial assistance in the areas that families need it, that changed the whole trajectory of their situation, has been amazing. Being able to provide wraparound services between our agencies and our programs has been amazing. And sometimes I feel like the data does not do the justice. You're seeing one way that we supported the family, but it doesn't connect in all the different services and the different ways. We serve the mom, we serve their youth through our youth programs, their families came to family events, we referred them for counseling, we provided financial assistance, and the data doesn't collect the wraparound services that we're able to provide. So hopefully we'll get better at how the way that we're asking the questions and the way that we're able to report the data to show like the tremendous wraparound services. And we're not just doing one thing, we might be doing 20 different things with a whole family. And so that's all I want to say. Thank you.
Great. Thank you.
I'll say something real briefly. One, I just want to thank you and just give you a brief example of what your decisions have done. We have families that need emergency hotel needs, and so we're literally taking families out of hot cars with infants, out of park benches with infants, and putting them into some safe haven while we work with them to get them into transitional housing, to work on their credit. We have economic development programs where we support them in increasing their credit and doing what it is that they need to do to get to where they need to be. Like Brandy just mentioned, everything isn't reported, and hopefully we can improve on that. But it's so intentional and it's so purposeful, and it's so amazing to be able to have the opportunity to support these families in these ways. Otherwise, babies would be dying more than they are now. Heat strokes, in the cold, freezing weather as well. It floods in Sacramento, right? And we got families sleeping in vehicles or on the levees. You know what I mean? So it's so imperative that we continue to do this work and to continue to be supported by you all in the way that we have been. So thank you.
Thank you.
Thank you.
Appreciate you. So those are our final speakers. I guess what I would just end with here, and then I'd invite my fellow commissioners to chime in if you are so inclined, but try not to be too discouraged by some of the data. No one saw a global pandemic coming, first of all, and none of us had the ability to control much of the circumstance around what that pandemic would ultimately do, which is isolate us all. And so I think you really need to think carefully about what you see in the data temporally, like, the months and the years where we see the numbers change in the wrong direction. And, I don't think there's any way you can ignore it. There's an association between the isolation that we all encountered and the fact that much of the great work that you are all doing and that First5 is funding and the county is championing, that is grounded in community. It's grounded in connection. It's grounded in all the things that a pandemic threatened. So I'm going to be very discouraged if once we get past the pandemic years and we see the numbers continuing to go up, that tells a different story. So let's be mindful of that. I think I'm really inspired to hear not people getting terribly down about things, but like this is the time to redouble our efforts. I think that's good for all of us to hear, and we should embrace that spirit of really accepting the charge to do even more. And we, as a commission, I think, have the responsibility to continue to do what we can in terms of the decision making that you expect of us to provide you the resources you need. Commissioner Guerra.
Thank you, Chair. First, I just wanted to, again, thank all of the community trusted partners and partners here and this commission. There's a couple things that struck out during the conversation that I wanted to, one, highlight, and that's from the perspective of my other previous hat on the board for the Family Justice Center. And I know Commissioner Hassett probably saw this as well, that during the pandemic, particularly with child abuse and domestic violence, we expected those numbers to be high and to grow even higher. But one thing that I think is true, and I think we heard it earlier, was that it would have been worse had we not had the intervention and the engagement from community partners who are here today. So one, I wanted just to highlight that component, and I feel very encouraged by just the level of connection between the partners. The second thing I wanted to bring up was your comment, Chair, on looking in and digging a little deeper on the homicides from 0 to 17 or 1 to 17, and that's in a previous work that I had been working on was on the issues of gun violence, and even Johns Hopkins University put out a report that showed the unfortunate deaths from mishandling handguns, and those were kids who were, basically handling those handguns as well. So I wanted to make sure that on the 1 to 17, like maybe we're not capturing that. Doesn't fall in the DV child abuse section, but it is one where still we see the largest number of fatalities. And what that Johns Hopkins report identified was that it was black youth that still were at a much higher rate than others that were impacted by it. So those two comments there. And then just as a parent who has had a young child taken him to the hospital for concussion, I just that testimony, I want to thank the father for their willingness to express that feeling, because it just brought back just memories of being at the hospital with a kid with a head injury, and how just traumatizing that could be. And so thank you to all those. And last but not least, I'll just say, I think my compadre here has seen our little one at the microphone too. So we see another future supervisor there on the. Right. So thank you, Chair. Yeah.
All right. Thank you, Commissioner. All right, Commissioner Wesley.
Hi, I have to gather myself together now. I just want to say to the women who are doing this work, the Black women who are doing this work, I thank you. Your ancestors honor you. They see you. In terms of the data, I want to say I'm incredibly inspired by the doula data around the 24 out of 26. I believe the data was that they were full birth, full term. I was like, oh my goodness, because it brings back those ancestral roots and that way of cultural connection to the mother. So keep, whatever you're doing, the magic, keep doing it. I was thinking about, is there anything that we can learn from that doula work for the perinatal? Is there something we can leverage, any gifts, any learning edges to close up those perinatal supports, minus knowing what happened during the pandemic? I think there might be some nuggets in there. I don't know. I'm curious. And then the other piece I think I wanted to think about was it was around the question about the hospitals. I thought I heard something about the experiences in the hospitals, but if I heard that correctly, thinking about how we could continue to create a more positive culture in hospital settings that is culturally affirming and creating better relationships in those settings so that we are seen and visible and those mamas are loved on and those babies are loved on. And then the last piece, I know that social media, I'm starting to learn more about social media. I never was on it till recently, working in policy.
You're the one.
I'm the one. Oh my gosh. It's kind of, I can see where like it does something to the brain or addiction, but I'm on Instagram anyway, that Instagram thing. That's all I'm on. But I'm wondering about the vaccination piece. Like, do people get misinformation or disinformation from that sphere, and is there something we need to do to counteract that and be proactive in that space? So just thinking, can we have some kind of campaign or leverage maybe existing campaigns that are out there so that we make sure that we have the right information on vaccinations? And that concludes everything now that I'm together. All right.
Thank you, Commissioner. Commissioner Moak.
I don't want to belabor this. I appreciate all the comments. I appreciate all your, doing the Lord and angels work out there every single day, and not feeling, that this was a punch. I appreciate your words about we have to use this as an opportunity to get better, do more, and I hope that hearing some of you and seeing you out there, helps, I think, just fuel us to know that there are people that are dedicated to doing this every single day in these communities and in these homes that these families that desperately need it. So thank you for that. I will say that, and Danielle knows this, years and years ago, we got a report actually here. It was an early evaluation report that showed that one of our home visitation programs was increasing drug and alcohol abuse. I don't know if you remember that. Danielle, it was at the very beginning when you started at Mann. And that was obviously somewhat interesting. PhDs and other people, very smart, were like, wait, what is happening? Well, how can a home visitation program, in fact, have this effect on people? Well, and you guys know what I'm probably going to say, which is when you take the assessment to someone, a new mom that you've just met, you have incredible skills, but still, you're asking questions. Have you ever done any drugs and alcohol? What are you using on a daily basis? And they're like, I'm not. I'm good. And you're like, okay, but what about smoking and other things? Nope, don't do that either. Over the course of time, when you're pouring into these families, they are trusting you more and more and more. And therefore, 6 months later, at post-test or whenever the next set of assessments come through, now they're like, oh no, I've been smoking weed for like years. And you're like, thank you. Like, that's awesome. Like, what an indicator of success that is for someone to disclose that they trust you enough to say that. And so I do want to be mindful, especially of some of those. I think the homicide, some of those are harder to lump into this category. But so much of it, what you do is relationship-based and trust-based. And the only way it works is when that's happening. And so for these families that also have been so used to not trusting things and for things that they cannot rely on things, that's why these long-term programs and support needs to stay consistent. And even in a time when we're facing numbers like this, it's what you said, it's more important to dig in and keep doing it. So I'm going to use that for my own, that's how I'm going to get through this hurdle, collect myself. And I'm thankful every day that you guys continue to do this for families and people that need it most. So thank you. No.
Oh, snap.
Yeah,
snap. Okay. I know. All right. Any other comments from commissioners? All right. Not seeing any. Okay. All right. Again, thanks to Linda. Thank you. You've been stalwart on this from day one. And Appreciate everything you continue to do. And of course, thanks to all of our partners and everyone involved with FRCs and MAN and again, the center and Sierra Health Foundation. And I know I'm forgetting all kinds of folks, but CAPC is, yeah, thank you. It is an impressive network of people that give a damn about our young kids in this community. We ought to be proud about that. All right, next is our last item, which is commission member comments. I'll get to my right and my left. All right, Councilmember Guerra, this is an unusually long meeting. They won't necessarily go this long every time, but welcome to the commission again, and to Shelby, thank you for being here. And with that, if there's no further business before us, we stand adjourned.